Rappel, s'il vous plaît, monsieur le greffier.
Monsieur le Sénateur Gorst. Monsieur le Sénateur Farnham.
Présent.
Madame Senator Ferguson. Monsieur le Sénateur Lafondre.
Présent.
Madame Senator Valois.
Present.
Madame Senator Moore.
Present.
Monsieur le Sénateur Pallet.
Présent.
Monsieur le Sénateur Mezek. Monsieur le Connétable de Saint-Hélier.
Présent.
Madame le Connétable de Saint-Laurent. Madame le Connétable de Saint-Sauveur.
Present.
Monsieur le Connétable de Saint-Brelade.
Présent.
Monsieur le Connétable de Grouville.
Présent.
Monsieur le Connétable de la Trinité.
Présent.
Monsieur le Connétable de Saint-Pierre.
Présent.
Monsieur le Connétable de Sainte-Marie.
Présent.
Monsieur le Connétable de Saint-Ouen.
Présent.
Madame le Connétable de Saint-Martin.
Présent.
Monsieur le Connétable de Saint-Jean.
Présent.
Monsieur le Connétable de Saint-Clément.
Présent.
Madame le Deputy Martin.
Present.
Monsieur le Deputy Southern. Madame le Deputy de Grouville.
Present.
Monsieur le Deputy Lewis.
Présent.
Monsieur le Deputy Tadier.
Présent.
Monsieur le Deputy Higgins. Monsieur le Deputy Masson. Madame le Deputy Pinel.
Present.
Monsieur le Deputy de Saint-Martin.
Présent.
Monsieur le Deputy de Saint-Ouen. Madame le Deputy Dublin. Monsieur le Deputy Labby.
Présent.
Monsieur le Deputy Wickenden.
Présent.
Monsieur le Deputy de Sainte-Marie.
Présent.
Monsieur le Deputy Truscott.
Présent.
Monsieur le Deputy Young.
Présent.
Monsieur le Deputy Ash.
Présent.
Monsieur le Deputy Morel.
Présent.
Monsieur le Deputy Guida.
Présent.
Monsieur le Deputy de Saint-Pierre.
Présent.
Monsieur le Deputy de la Trinité. Monsieur le Deputy de Saint-Jean.
Présent.
Madame le Deputy de la Hegra. Monsieur le Deputy Aye.
Présent.
Madame le Deputy Peshard. Monsieur le Deputy Ward.
Présent.
Madame le Deputy Alves.
Present.
Monsieur le Deputy Pamplin.
Présent.
Madame le Deputy Gardner.
Present.
Monsieur le doyen.
Notre aide soit au nom de Dieu qui a fait les cieux et la terre. Amen. Seigneur Dieu, Père éternel et tout-puissant, qui a établi le gouvernement et les puissances de la terre, pour le règlement et pour la conduite du peuple, et qui nous a commandé d'avoir toujours pour but la gloire de ton saint nom. Nous te prions que te plaise de donner à cette assemblée le don du conseil et des prudences, d'unir les cœurs et les affections de tous ceux qui la composent, et de les conduire tellement toi-même par ton Saint-Esprit que toute l'heure de libération est accompagnée de ta bénédiction. Réussisse au bien et au soulagement du peuple qui au de plus de commettre à le soin. Car nous t'en prions au nom et par les mérites de ton Fils bien-aimé Jésus-Christ, notre Seigneur, qui nous a enseigné de t'invoquer en disant: Notre Père, qui es aux cieux, ton nom soit sanctifié, ton règne vienne, ta volonté soit faite sur la terre comme au ciel. Donne-nous aujourd'hui notre pain quotidien, et nous pardonne nos offenses, comme nous pardonnons à ceux qui nous ont offensés. Et ne nous envoie point en tentation, mais délivre-nous du mal. Car à toi est le règne, la puissance et la gloire, au siècle des siècles. Amen.
Monsieur Le Santa Gorst,
Excusez, I think.
Madame Le Santa Ferguson,
Excusez.
Monsieur Le Santa Mezek,
Présent.
Madame la Comptable de Saint Laurent,
Excusez.
Monsieur le Deputy Southern,
Excusez.
Monsieur le Deputy Higgins,
Excusez.
Monsieur le Deputy Masson,
Excusez.
Monsieur le Deputy de Saint-Ouen,
Présent.
Madame la Deputy Dublé,
She indicates in the
Present.
chat it's present. Ah, you're there anyway, Deputy. Very well.
Monsieur le Deputy de la Trinité,
Mallard.
bonjour que Monsieur le Deputy de la Trinité est tellement disposé qu'il ne peut pas assister au test sans exposer sa santé. Madame la Deputy Pershaw,
She indicated in the chat that she was present as well, so she's marked as present. Les états sont constitués. Very well, the final matter of public business before the Assembly is the proposition of Deputy Tallier entitled COVID-19 Hospital Patients Visitor Access P8, and I ask the greffier to read the proposition.
the states are asked to decide whether they are of opinion to agree that people who do not have COVID-19 should be allowed to visit people in hospital, and to request as a matter of urgency the Minister for Health and Social Services to instigate a robust system to keep people who do have COVID-19 from visiting people in hospital.
Deputy Tallier.
Thank you, sir. So we find ourselves on the last day of the sitting anyway, and we do now have the benefit of some, I believe, helpful comments from the Minister. So I thank him for preparing those. And I thank members also for allowing this debate to go ahead. I think it is, it's an unusual matter of, I think, importance to many islanders, because it speaks to so many issues, not just about infection control or about COVID. What I do want to say in my opening remarks is that this debate should not be about, and I won't let it be about, I won't let it be about pitting hospital staff against patients' safety and rights to receive visitors, or indeed the rights of family to be able to visit their loved ones who are perhaps in a very critical or down and low condition whilst they're in hospital, currently being unable to see anybody from their social circle or family or circle at the moment. And I will take any comments that are made in that vein quite seriously in my summing up, but I hope that we will have a respectful debate, sir, that recognises that we're still in a difficult position, but that we need to balance people's rights. I also want to touch on the fact that when it comes to healthcare, whatever it is, and whether it's people who have contracted COVID or not, that we need to be treating patients holistically, and that whilst we might be, and this has been a theme that's run throughout the restrictions that have been that we've put on people throughout the pandemic, sir, is that it's always a balance between protecting people's physical health from preventing the spread of COVID, but balancing that with the downsides that are that arise from the restrictions. And we know that in order for patients to recover, that they don't just need to have physical treatment, but they also need to have psychological and emotional treatment, which often isn't and can't necessarily be expected to be provided by the hospital staff. That usually comes from friends and family. And in normal circumstances, we would expect visiting rights to be respected. I also want to contextualize it that we've been through now, it seems it's over 2 years of COVID and COVID restrictions. And we haven't just been dealing with the virus, but we've been dealing with the effects of the restrictions from the virus, which I think have taken their toll on many people in society, even where COVID itself as a virus hasn't taken its toll necessarily on them. And people have largely complied. When we told them to get a vaccine, they got a vaccine. When we told them to get a second vaccine, they got a second vaccine. When we told them to get a third vaccine, they got a third vaccine. When we asked them to wear masks, even when they didn't, most people did wear masks. And when we told them that they had to wear masks, of course, they had to wear masks. And that's the situation where we find ourselves in. But nonetheless, it has to be said that we have left sections of our workforce in particular at greater risk than I believe has been acceptable. And I think this is true when it comes to healthcare staff and when it comes to teaching staff. But we're obviously focusing on the former today. And the other concern I've got, and I will address, I think, in the first instance, the comments of the minister, is that whilst it's quite clear that he says he's taken advice from infection control, and I quote directly in his third paragraph, he says, "I'm acting on the advice of our clinicians who have a duty to keep patients safe." Yes, he does have a duty to take into account, I think, what clinicians tell him, and clinicians have a duty to keep the ward safe. But as a minister, he has an overarching responsibility, not just to hospital staff and to keeping hospital staff safe, which I have to say he's failed to do on this occasion. But also he has a responsibility to the wider community, to the patients, to be able to receive visitors and for visitors to be able to go about their ordinary business of visiting their family and providing that support I spoke about in my opening remarks. So the comment is also made that they're acting to keep patients safe and that they have a duty to place the needs of patients first. That's another direct quote, sir. And of course here, the patients have multiple needs. That's the issue. They don't just have a need to be treated physically, they have a need to have emotional support from their family. And these needs aren't being put first by this blanket ban. It goes on to say that ward teams are identifying those patients that are appropriate to be considered under exemption. And I think this is the big rub here. Is remember, part of what I'm asking for in this proposition is that there should be a robust system put in place to keep COVID out of the hospital and to stop it spreading. Now, we haven't had a robust enough system up until this point. Otherwise, there wouldn't be 29 confirmed cases in health and community services, 27 of which are at the General Hospital. So and this is a problem because that's a problem that affects staff, patients and visitors. And if only there had been a more robust system put in place, one that was policed, for example, that was proportionate and reasonable, then I think we wouldn't be in this case in the first place. I am heartened, sir, that the minister says he doesn't oppose this proposition. I hope that means that he might even support this proposition. But again, I don't want this to be some kind of hollow victory where this is passed, but in fact, the minister is still saying, and this is the not just the subtext, but I think the actual text of his argument, it is saying that he really will be led by clinicians on this. And so if the clinicians say, no, we don't want to raise the ban, we don't want to lift the ban on visiting, then unfortunately that won't happen, because what we've seen here is that we have a minister who quite rightly listens to clinical advice. But unfortunately, and I think it's not an issue that's isolated to the health minister, He finds himself being led by that advice rather than taking the advice into account and he himself being the leader, because as I said, he does have other considerations to take into account. One of those considerations is human rights. And I hope this doesn't happen today, but there used to be a time when in the States, if you mentioned human rights, that half of the assembly, if not more, would switch off and say, oh, we don't have human rights in Jersey, do we? But this is a real issue, because the minister said he's acted on clinical advice and considerations, but has he acted on human rights advice? We know that when a ministerial proposition is lodged, there's a section which takes into account human rights considerations, and there's a statement to that effect. When it came to this blanket ban on visiting at the hospital, I call it a blanket ban because that's what it is, albeit with some exemptions which are really difficult, I think, for family members to enforce. We'll go on to that and to actually enjoy. We'll go on to that in a moment. The minister, the comments about human rights advice are singularly absent from this proposition, and that says to me is because they weren't taken. There wasn't any consideration of human rights. And what are those rights that should be considered? I raise these issues because human rights can't just be something that are respected in the abstract. There are many of us, I think, who to a larger degree or lesser degree consider ourselves to be libertarians, and that we only will sanction state intervention in normal rights and in family life where it is justified and proportionate, and there is no other way of doing that. And what we've seen here is actually an absence of that evidence, is that we know there's a problem. I think we're all united in the fact that we want to keep COVID out of the hospital and to get it out of the hospital. But what we're not clear about is the best way to do that. And so whilst it might be very efficient for the hospital to say we're going to just close down the wards and not let anybody in for a period of time, that isn't a reasonable political solution to it, sir. I would suggest, because people do have the right to expect ordinary family life within reason. That said, people are not naive. They're not expecting things to go on as normal, and this is, I think, where we have the rub. We were initially, I think, told by the minister or led to believe that the ban was based on the fact that people have been turning up at the hospital, they've been behaving abusively and not willing to provide evidence of a negative test. I can't speak to that. I have no reason to doubt that may have occurred, and that is unfortunate, and that can never be condoned. But similarly, I've heard lots of stories about people turning up at the hospital, presumably named visitors, saying, I've got my lateral flow test here, would you like to see it? And they'll say, no, it's okay, just go in, we trust you. And I think when you have a system that relies on a high degree of discretion, or that isn't policed properly, and the rules may differ and the interpretation may differ from case to case, that is when you will get, unfortunately, but understandably, you will get people reacting in a possibly hostile manner, because they'll say, well, you didn't ask that person to provide a test. I don't have any lateral flow tests. I've been keeping away from people. Why should I provide this? But if we had a clear system which says, no, in order to visit, for example, you must be a named visitor, you must make an appointment, you must register with the testing service on eGov. I did it last night. I did a lateral flow test before going out to a social event, a musical event, and I knew that as far as possible I didn't have COVID, so I was being responsible there, and I registered, and I got a message back on my phone saying you've registered your lateral flow test, and yeah, you can go about your ordinary business taking the ordinary precautions, and that works. We have that system set up, and we've invested so much in this island in terms of the border force. When people have come visiting the island to keep the island safe, we've invested so much in that. We've invested a lot in the scheme, the furlough scheme, and all those schemes around the workplace. Yet when it comes to perhaps the most vulnerable, who find themselves acutely ill or perhaps morbidly ill in hospital, we find ourselves in a position where we haven't been able to keep those safe. And just in passing, I did inquire over the last few days about what the system is at the prison. And it seems that we've managed to have a robust system for visitors at the prison. I know arguably there are fewer people that come in and out of the prison, but in terms of visiting inmates in the prison, which I would say, if we make a parallel with visiting patients at the hospital, you're better off being a prisoner at HMP Lemoy, because you know that you can turn up once or twice a week and that you'll be allowed to visit, and that there'll be a robust process to keep you, to keep the inmates and to keep the staff safe. Unfortunately, we don't have that at the hospital. But sir, I'm not here to bemoan the current state of affairs, because I know that everybody's been dealing with a difficult situation. What I want to get us to is the point at which we do agree that we need a robust system at the hospital. It should be proportionate. I don't think it necessarily means keeping everybody in a holding pen until they've been tested. And to address a couple of the red herrings before they come up, because they certainly did come up in question time the other day. This isn't about testing every single person that comes into the hospital to make a delivery, to go to outpatients, to go to pharmaceutical or pharmacy to pick up their hospital prescriptions. What this is saying is that if you're allowed to currently go into the hospital to go about your own business, then that shouldn't change. And if there are other restrictions which are proportionate, they should remain in place. But that when it comes to being able to visit somebody, so if you don't have COVID, this is the starting point. If you don't have COVID and you want to visit somebody else in hospital who doesn't have COVID, you should be able to do that safely. Having a restriction on you visiting doesn't really make any sense. And what we should be saying to those people, and what the minister should be saying to the department, is how can Mr. X go and see Mrs. X in the hospital, or Mr. X see Mr. Y, see Mr. Y in the hospital safely, given that neither of them pose an inherent risk and their introduction into that environment doesn't increase the risk? How can we get them safely from point A to B without any risk of them catching an infection? And that should be possible, sir. That should be entirely within the intelligence of our ministers to be able to do that, and to do it urgently, sir. And it shouldn't be down to the ward teams, and this is where I quote again, ward teams are identifying those patients who are appropriate to be considered under an exemption. So let me quote directly from somebody who contacted me this morning at 7 AM. And a couple of members will know about this. I certainly know the Deputy of Grewville will have been contacted, I think, by somebody last night, and this is another relative of the same person. And they're basically saying that, I'll read this, it doesn't identify the person. My parent is in hospital now receiving palliative care. We are not allowed to visit. So that's not what we were told. We were told that people who are palliative could receive visitors. Remember, this is somebody who doesn't have, a patient who doesn't have COVID, who may have had it, but doesn't have it now. She's receiving palliative care in hospital, and the family are told that they can't visit. They say, we're waiting for the dreaded phone call to say that she's passed away. Please, can you advise me about the rules, and can we insist on seeing her? Well, this isn't a great state of affairs. I mean, I feel very strongly and very much for that lady. I think some of us in the Assembly have been through a similar situation recently, and many of us will have been through that difficult period of losing loved ones in the past. And all I could say is that, look, if you should be allowed in, that's what we've been told. You should be allowed in, and I'm raising this issue with the minister now. And I said that if this was my mother, I would be insisting to go in there. I would be going up to the ward. I'll be going up with my full PPE, with my lateral flow test, saying, look, I'm negative. I've done everything that I need to do. I want to see my mother whilst she's still conscious. whilst she was still alive, so I can say my last goodbyes to her, because I was able to do that. And I think that other people should be able to do that as well. And it shouldn't be down to the ward staff to be making these judgment calls. But by the time somebody gets on the ward, it should be because they're allowed to be there, and because they are safe to be there, and they have an appointment, let's say. I mean, these are not unreasonable things, and we've been through all this when it comes to care settings. So members will have also read my comments in the proposition, which gave some other examples. Case one, I'll read them quickly because I think it's important these people have their voices heard. Case one said, sadly, since my email, my parent has been diagnosed with cancer and a secondary cancer. I'm still battling day by day to be able to have a family member with them. This is in between the period of last Thursday or Tuesday, whenever it was, Thursday, I think, when the ban was imposed. And I have asked for exceptional circumstances. Yesterday, my parent used the iPad and I saw my parent break down in tears. We can't be next to my parent to comfort him or her. Sorry if that's clumsy wording, but I've deliberately phrased it to not identify the person as best as possible. But what a situation to have somebody like that who's not only been diagnosed with cancer, but secondary cancer, to be told that they have a limited time to survive, and to do that over iPads when we know that we've got such a great system of testing and safety in place already. And the second case, another person told me my parent is very fragile and has been in hospital for more than 4 weeks. I'm unable to visit. My other parent is also unable to visit. They've been married for over 60 years. I believe the lack of family contact at this critical time can only be having a detrimental effect on my parents' chances of recovery. So I'll read that last bit again, because that's what struck me, is that I believe that the lack of family contact at this critical time can only be having a detrimental effect on my parents' chances of recovery, sir. So what I want to add here is that I'm going to finish this now because I think we get the gist. I hope that members can support this, but I want to frame what I'm asking of the minister. I want him to have a sensible, proportionate system, where the presumption is that you can visit, provided that you're not a risk, and that that the patient is not at risk, sir. And I think there are lots of people in there, and I know that we've got wards which have lots of COVID. We have some wards which have some COVID, and I don't want to go down the rabbit hole, like I said, of what the minister told me on the phone. Was what if somebody goes to the pharmacy and then they end up on the ward? And what I would say is that even in normal times, we need to have a better system in our hospital. You can't have people wandering aimlessly around the hospital if they've got no legitimate reason to be there. But unfortunately, I think that's exactly what can happen, certainly in normal times. I've been in hospital more times than I care to remember to visit people, and I go there for a specific purpose, to visit a person, then I leave. But if I wanted to, I'm sure that I could have gone from ward to ward, and that without actually anybody talking to me, without anybody saying, what are you doing here? How can I help you? Are you here to see somebody? And in fact, that has been largely my experience when I've gone to a ward, let's say in ordinary times, but maybe even more recently, is that there isn't somebody there on the ward to greet you and say, hello, how can I help you? Which is not for politeness, by the way. It's nice to have that. And it's nice to have that for family members who are perhaps in a deeply shocked state and who don't necessarily have the wherewithal to deal with the government system and the hospital part of that system. But certainly just for security, you want to make sure that you know who's on the ward. And I think this shows that there's a bigger underlying problem which will need to be addressed in the future about what we expect from our hospital. And again, I say this in the context of paying tribute to all the great staff that we have on all of the wards who have got so much to deal with at the best of times without COVID and without having to police a system which hasn't been fit for purpose, sir. So I do make those comments, sir. I'm aware that I may not have addressed all the potential red herrings that are going to be coming my way, but I hope that we can have a sensible and constructive conversation. And if you feel the same way that I do, just ask the Minister to lift the ban as soon as possible, but to put in a proper system in place. This isn't a choice about having a robust system or having visitors. I'm saying we need to do the two at the same time. We need to do the two urgently. And if it means that other departments and other ministerial colleagues need to support the Health Minister by making that happen so that other staff can be drafted in to help with the COVID response, then that is exactly what we should be doing, sir. Thank you. And I maintain the proposition, sir, and ask for presumably for it to be seconded.
Thank you very much. Is the proposition seconded?
Yes, sir.
Gontardus and John.
Thank you, sir. I won't be troubling the clock today, sir. On Tuesday, I spoke in favour of this debate being the last item, so we could have all the information. We've got information on patient numbers, but again, HCS is not able to provide information on staffing, other than to say staff have been redeployed from education, management and non-inpatient care roles to support ward activity. We've been given numbers, no information on how many staff are off with COVID or what sickness levels there are in health at present. And with staff already deployed, I'm guessing that number is high. I think, sir, it's worth repeating what I said yesterday about staff numbers. In July, the Health Minister told me there was 8% vacancy limit. The 2nd of November, the Health Minister told this Assembly there was a 5% vacancy, 5.3% currently, and that's not unusual for an organisation this size. And yet a freedom of information question asking for vacancy levels on the 1st of November puts that level at 14.2%, some 353 vacancies. So if there is a problem with staff levels at the hospital, and that's the reason that people can't go and visit, let's tell the public. What is the reason? Being a patient in isolation can be difficult. Having a loved one in isolation who doesn't have COVID can be difficult. I hope that Deputy Taddeo would agree with me that other visitors that he mentioned to the hospital, such as going to the pharmacy, etc., should be encouraged to take a lateral flow test in any way. We should encourage everybody going into public buildings to take a lateral flow test. The staff in the hospital are under incredible pressure, and I'll repeat my thanks of yesterday to all of the frontline staff who are doing an incredible job in very difficult circumstances. I hope that the Minister can confirm that those patients receiving palliative care can have close family visitors, and I hope that that can be rectified immediately. I also hope the Minister can give us an update on staffing levels to help me and others decide on whether or not to support this proposal and give us the real reasons. I will listen with intent, sir, to both sides of the debate before deciding on which way to vote. Thank you, sir.
Very much. Deputy Pershard.
Thank you, sir. I am hoping that the Minister will speak during the debate. I'm sure he will, to address some of the questions and concerns raised. I'd like to just comment on a couple of aspects of the information we were given when the press release first went out. I have a couple of questions that I would welcome an answer to from the Minister if he is able, and a couple of comments in support of some of the things that Deputy Taddeo expressed. I think pursuing a sensible and proportionate solution is a reasonable request. I think that that's when Deputy Taddeo used those words, I've personally felt that that's something I could get behind, a sensible and proportionate response. We've been told that there are exemptions in place for patients receiving end-of-life care, maternity in the maternity ward and the SCBU, the special care baby units. I have a couple of questions particularly pertaining to all three of those, and I'll go through them quite systematically and concisely, and I hope that the Minister will be able to provide some clarity. When we talk about exemptions for maternity, what does that look like? What does that literally mean? And what testing regime do the people under the exemptions have to go through? So assumedly, those visitors will still have to go through some sort of procedure to show they're COVID negative before visiting maternity. And what is that process? Those questions also apply to SCBU. And I'd like to say that in terms of partners, parents of babies in SCBU who aren't the birth mother, I'd like to know explicitly what exemptions are made for them, and again, what does that look like? How does it impact what were the usual rules around the time of day they could visit, how long they could be there, what they have to do when they arrive? Is it still full PPE and tests and lateral flows? You know, what is it that parents, typically fathers, obviously not exclusively, but most of the time fathers coming into SCBU to visit their childbearing partner and baby, what are the restrictions there? Because anything other than basically what they had before, to me, would be quite unacceptable. When it comes to end-of-life care, again, I would like to understand what those exemptions are and just point out that it isn't always completely clear when someone is reaching the end of their life when they are very poorly. And we had a family member last year who sadly passed away during the pandemic. And we were not able to visit them. And we were very sad about that. At the time, it was quite early in the pandemic. And so I think at that time, we were also terrified of making this family member sick by passing them asymptomatic COVID we didn't know we had. There was so little that we knew. Sorry, when I say last year, I actually obviously mean 2020. There was so little that we knew about the virus. And so at the time, even though it was hard, we were much more accepting, I think. And I think it was much more acceptable to request people to stay away from vulnerable patients. However, it was incredibly hard. And reflecting on it is actually harder than it felt at the time, because as I said, at the time, we were all very scared of making this person sicker. And so we kind of accepted that that was what we needed to do. That was our duty to protect them. But now we are in a completely different position where people are vaccinated and can prove that they're vaccinated, and we have lateral flow tests. And the reason I bring this up, even though we've said there are exemptions, is because for us, it wasn't clear that it was end-of-life care that this relative was having. We didn't know necessarily that they were going to die. And so I imagine that that is not a unique position. And I imagine that there are people with family members who aren't sure how long they have. And for us, this family member was in hospital for weeks and weeks. And we were so fortunate in that the week they died, they were allowed to move into a nursing home. And so we were able to see them from a distance, having not seen them for weeks. But again, you know, we did not know that that was going to happen. It was just a few days after they were released from hospital. So if we took that circumstance and applied the rules that we're applying now, I would be outraged. now, being triple jabbed, doing lateral flows all the time, being very careful day to day, because we also have another vulnerable family member still, and I have a young child. So we are being very, very careful, and we have all these protections in place. I understood it in 2020, even though it was hard, and even though it was devastating. My family and I understood it, and we obviously complied. But now, if we were where we are now back then, I'd be livid. I would be heartbroken, and I would not be able to comfort myself in the way that I can now, because at the time it was the right thing to do. I still maintain it was the right thing to do to protect that vulnerable family member. And I say all of this because I do think that this is not as sensible and proportionate as it could be. And I understand why there might be a feeling that this extreme response is necessary. But I do think that we're in a different place now to where we were in 2020. And I do think that that should have significant impact on these policy decisions. I'd like to just finally add that the rule about one adult accompanying a child to A&E is also something I find ill-considered. I think that if you have a child and you have to rush to hospital with that child, and you are a parent, it shouldn't matter if you're the mother or the father, a mother or a father, and it shouldn't make a difference to how we perceive how much someone's affected. You know, the parent of a child who has to go into hospital is emotionally affected, and we can't pit one parent against another in this emotional way. If my husband and I took our child to A&E and I was told, well, he can stay, but you have to leave, I just wouldn't leave. I just wouldn't go. And it'd be the same if it was the other way around. My husband would not tolerate that. And of course, there are different circumstances, you know, different reasons why a child might go to A&E, but to have this blanket rule, it doesn't make sense to me as a parent, as a and just as a person, as an empathetic person. It doesn't make sense to me. I think that should be revised. I think we undermine people when we refuse nuance. I think that people understand more than we are giving them credit for when we do these extreme things. I think that there is a much bigger place for nuance, and not just in this instance, but in politics throughout. We discredit the intelligence of the population when we say, well, we can't have a nuanced policy because people won't understand it. And I think there is a place for that. And that's, so I'd like to add to Deputy Tadier's adjectives: sensible, proportionate, and nuanced. Thank you, sir.
Very much. Deputy St.
Sir, I had wanted to speak early in this debate and had asked in the chat, but the last two speakers have asked some deeply operational questions of me, which quite frankly I'd like to seek advice on before I speak. So I've asked perhaps too early.
You're withdrawing,
and I wonder if I might defer, sir.
Well, it's not a question of deferring. You're withdrawing your request to speak at this point, Deputy. Yes.
Thank you, sir.
Very well. Deputy Doublé.
Thank you, sir. I'm grateful to Deputy Pershad, who has articulated some of the points that I was going to make, and indeed asked some of the questions that I am also interested to know the answers to. And members won't be surprised that my questions also centre around maternity, so I look forward to hearing the answers from the Minister. And we've heard from some previous speakers about the impact of not being able to have contact with loved ones when there is an illness, and of course we heard some similar points being made when we were discussing having enabling pregnant women to have support partners with them when they're having scans, and hearing how critically important that was in terms of their the care that is provided to them, and that support partners, I think it was the Royal College of Obstetricians and Gynecologists, had stated that that support, from a close person in the woman's life is actually part of their medical care. And I think that's something that we need to be mindful of here. And Deputy Tadia expertly made that point as well, about how loved ones are concerned that not being able to see close family members is actually contributing medically to declining health. And these things are hard to measure, of course. And I think sometimes when we are, I think sometimes when ministers are making decisions, and of course they must listen to medical advice and expert advice. As much as anybody, as a person with a background in psychology, I understand the importance of rigorous evidence. But we also need to think about this as human beings. And I'm disappointed that these restrictions are still in place now at this stage of the pandemic. And actually, sorry, sir, I just wanted to add a question before I make some points. I did want the Minister to clarify specifically about visitors accompanying women who aren't actually in the hospital, but who are visiting the hospital, pregnant women who are visiting hospital for scans or other appointments related to their pregnancy. So if the Minister could clarify that, I'd be very grateful. So Deputy Tadia is basing his arguments around human rights, and this resonates with me, sir, as a humanist, and I think we need to think about human rights a bit more when we are debating, especially things like this that involve what is essentially having human contact or not having human contact with a loved one at what is a very vulnerable time, to varying degrees, of course, for people in hospital with different conditions. And Deputy Pershad mentioned that the response that we have should be balanced and proportionate, and I totally agree with that. I think that given the resources that we have put into other things in the pandemic to make sure there are safeguards to allow people to do things that we deem to be important, given those resources that we do have as an island, why are we not putting those resources in here? So take travel, for example. There was a setup at the airport to provide PCR tests, which I know, of course, is a different type of testing to the lateral flows, which would be used for hospital visitors, probably. And that system was super efficient. Anyone who has travelled through the airport when that has been in place, you join the queue, you do as you're told, you get your test, and then your results come through, and you follow the instructions, and if you want to travel, that's what you have to do. Likewise, for people who want to visit the hospital, personally, if I had a loved one in hospital, and very recently, in the last month, I have had someone very close to me who died in hospital, not in a Jersey hospital, but in Ireland. I would, without a shadow of, without a moment's hesitation, I would comply with being subject to a lateral flow test by a member of staff, so it's supervised, and I would comply with having to wait the 10 minutes or so for a negative result before I was allowed in. I would absolutely comply with that. I would be happy to do so, and in fact, so I would probably feel more comfortable because I would then know that I was protecting my loved one if that test was done under supervision. So why are we willing to put resources into supporting things like travel, but not into supporting seeing loved ones in hospital? Is it because the testing at the airport, was that put in place because we deemed it an important human right that our freedom of movement should be allowed, or was it there because that freedom of movement was important for the flow of money into our economy? If there was a monetary value on the relationships we have with the people in our lives, would we even be questioning this proposition from Deputy Tadier? We can't put a monetary value on those relationships. But sir, I'm sure I speak for every other member in this assembly if we really, if we are honest with ourselves. The most important things in our lives are the people who we love and the people who love us. There is nothing more important than this. So in order to put in a robust, safe testing system to allow people to visit their loved ones in hospital, who, as Deputy Pershad again pointed out, we might not know when people are near the end of their lives. We should invest in whatever is needed, and I don't think it would be a huge cost. We should invest in that to allow people to access their loved ones, because from personal experience, not being able to visit a loved one at the end of their life is a regret that I will hold for the rest of my life. And I do not want any other islander to have to experience that. So I hope that members will support this proposition today, that we can help to facilitate people to be together. Thank you, sir.
Thank you very much, Deputy. Deputy Greville.
Thank you, sir. I must say we are receiving some very considered speeches this morning, and I'm very grateful that Deputy Tadier has lodged this proposition, because I must confess, when it was brought to the Council of Ministers last week and the suggested measure of banning visitors from the hospital, I too described it as draconian, a draconian measure, and I stand by that, sir.
Sorry, Deputy, have you concluded your speech?
Sorry, no, sorry. Sorry, I'm having a bit of trouble with my computer. No, I don't know where I got up to, but
You said that you had described it at the Council of Ministers as a draconian measure, measure, and then
yes, sir, and I still stand by that. I still stand by that description, because I really don't feel that we have the right to ban people at their from visiting their loved ones when they're at their most vulnerable. And I understand the clinician's point of view, and this is obviously an easy measure just to ban people from the hospital, but it is not the right one. It might be the easiest way to be clinically safe, but it is not. It does not consider the holistic care of that patient, in my view. As Vice Chair of the COVID task force, when that was put together at the start of lockdown, we had measures in place within days, if not sort of a couple of weeks, where we had measures at the at supermarkets, all over the place, where people conducted themselves and sort of were very good with the guidance. We had community support groups going out, assisting the vulnerable in our community. I just think that this measure that's been suggested is so carte blanche. But I'm afraid it's not the right one. It's not the right one for the patients who, as I say, need more than just the clinical care. They need the care of their families and loved ones. And it's not the right decision for the staff in the hospital, putting them in a position, putting the people in the position in the wards to make those decisions. And that is when there will be abuse taking place, because the decisions will be subjective. And I don't think it's fair to put staff members in that position. We need to adopt some measures where everybody knows where they stand. At the moment, what worries me as well, by putting these measures in for this one building, you know, we had the whole island locked down and were working, but we can't seem to sort of devise something for one building to protect the patients and staff in the hospital. So I don't think enough thought has been given to this issue. And I rather think, a bit like Deputy Doublé has suggested, if it was to do with the economy, we would have different measures in place. We wouldn't just have a carte blanche ban like this. The other issue that worries me, we have a backlog at the moment of people that haven't been attending regular checkups in the hospital. But this is only going to deter people yet further. So I would ask the Minister for Health to come forward to consider this issue, to allow patients to receive visitors and put in place measures that protect both staff and patients alike, that we know that people will abide by, because they have abided with the measures that we have put in place so far. Thank you, sir.
Thank you very much, Deputy Wickenden.
Thank you, sir. I think I'll start. I know Deputy Tadea made a point to say this cannot be about pitting staff and visitors away, and he'd be very harsh on anyone that mentioned it. But I hope he doesn't mind mentioning that there should be a consideration in our deliberations. We can't just discount anything that there is a staff level as well. There are many hard-working health workers that go to the hospital and deal and support and look after our family members and our friends through times. You don't go to hospital because everything's rosy and happy. You're going to hospital. So I hope that the deputy won't be too harsh on me, just to say that when we're deliberating something such as this, that we can't discount one aspect of the debate. We don't get to choose to just ignore one part of what we need to talk about. And I know the staff are worried about themselves as well. And there is a level of consideration that has to be taken in with these decisions, and it was taken in when the decision not to change the visiting rules was applied, and there were exceptions. It wasn't a blanket ban that was made. There was discussions within the Council of Ministers and I'm sure with clinicians and the Minister to say that we need to control. Of course, there needs to be a level of support. There's mental health deliberations that need to be taken into consideration as well. The clinicians are not just thinking about themselves. There's been a lot of, don't listen to the clinicians, or listen to them, but with a pinch of salt. You've got to make up your mind across everything else. The clinicians aren't just looking at themselves. They're not trying to be selfish. They're trying to look at the running of a hospital and the risks. And this debate is about risk and how much we as politicians feel that there should be a risk profile associated with our sick and vulnerable, and how much the clinicians feel that a level of risk should be associated with such a decision about visiting, because we are talking about people that are on medications, that are on in wards and are unwell, which is why they're in the hospital. There has been, from what we're hearing, and I have to believe what they say, that there's been a level of abuse towards members of staff within the hospital around such things as even wearing masks. I, as Education and Children's Minister, have dealt with an awful lot of correspondence from people who think that masks absolutely ridiculous, they do nothing, actually they do more harm than good, and they absolutely will not wear a mask no matter what you do. And they're going to want to go and see their relatives and the likes in hospital if they have them in hospital. They don't believe that, they believe the vaccine is absolutely wrong, and they will not have the vaccine at all, and they will stand up for their rights. We've seen them outside the States Assembly all crowding around to tell us how evil we all are for allowing vaccines to be even considered in Jersey. Now, they would like to go and see their loved ones who are in hospital, because they don't believe that COVID exists. They don't believe the vaccine is anything other than a conspiracy, or it's untested and unsafe. They don't want to wear masks. Who do we put on the door to say, well, actually, I'm afraid, you know, we've got some levels of control in place here. You and your views, as much as you're allowed your own view, you're not allowed in the hospital if you're not going to wear a mask, and you're not going to get tested, and you don't believe in COVID. Unfortunately, we're not going to allow that risk in the hospital. Who do we hire? The TA? Do we put in honorary police? Do we get G4S security, or other security companies do exist that could be used? Are we doing proportionate, or are we doing robust? LFTs are a really good measure in a morning to go and give you an idea about your risk profile for the day. Do you need to go and get a PCR test? How are you going to associate with your day going to school and the likes? We're using them, and they've been very effective. But that your day normally associates with going to the shops or going to work and the likes, not always going into areas where there's very vulnerable people. And LFTs, I agree with Deputy Doublé that if we were going to do LFTs, it would have to be on site. It would have to be on site, because anyone can bring an LFT from a week ago, a month ago, that says that they're negative, and you have no way of knowing that that LFT was taken that morning. So do we go down the PCR route? The Deputy Tadia has talked about the prison. Well, you have to book to go to the prison. You have to get your time and your date to turn up there. You have to go through a security check, in a very severe security check anyway when you're visiting the prison. No mobile phones, no metal objects, going through without luggage and the likes. So there is a level of a risk profile at the hospital and a risk profile at the prison, and we need to accept what the risk profile is. Now, I agree that the ward staff shouldn't be the ones that are responsible for doing the checks and balances, and they shouldn't get the abuse from the people who have different views and different risk profiles to what we have. So I'm not understanding in some aspects how we've got to this position here, because we're politicians. I agree that if we should have a risk a testing regime, it should be robust, as the proposition says. It should be robust, it should be strong, and it should take into consideration the risks, not only to our loved ones, but to other people's loved ones. It's not just about...
You're asked if you'll give way for a point of clarification from Deputy Tadier.
No, sir. Deputy,
Very well.
The deputy gets to sum up. There's been a lot of speeches about my loved one and my example and how it goes here, but you've got to remember that there are other members of the public who may not be happy with this level of risk for their loved ones in the hospital. I think that the decision that was made was never going to be a long-term one. I think, and I know we are still in a pandemic, that when the decision was made, we had nearly 4,000 positive cases in the island, and most of the cases were in the 18 to 40, I think, were the highest rising numbers in the risk profile, which are generally the people that would be going and visiting in hospital. The decision was made to stop general visitation to the hospital, with exceptions for all the right areas, I believe. And I just don't think, as politicians, we're the right people to suddenly start telling a hospital how their risk profile should be. I'm struggling to still support this proposition, though I know it will go through. I will stick with the words robust in the proposition as they have been set out. Any system that allows visitors right now, while we're in a pandemic, while we've had a new variant and we had high levels of numbers, should be robust. But the numbers are going down because we've got masks in place and the public are doing the right thing at the moment. But we've got to consider everything, not just our family members, but other people's family members, and the vulnerability in the hospital. Nobody's in there because they're all happy and well, well, except the staff, I hope. So we've got to consider it all when we're making this decision, but proportionate and soft isn't where we need to be here. Robust, as the proposition says, that's where we should be. Thank you, sir.
Very much. Deputy Ash.
Thank you, sir. I'm pleased to follow Deputy Wickenden there. He actually raised a point I hadn't particularly considered, and I think he's right. We do sadly still have a fairly high percentage, really an unfortunately high percentage of people who refuse to be vaccinated on the island. The same people refuse to be tested or object to being tested, and many of them won't wear a mask either, and that's because it infringes their human rights. Or so they want us to believe. It infringes their human rights, and to an extent it does. And I think that when Deputy Tadier talks about human rights, we can extend human rights or we can limit human rights, but at times you have to do what is good for the majority of people. And I think that's what the hospital authorities are looking to do here. I haven't yet decided whether I can back him or not. One or two things that have struck me already in this debate, sir, is some of the language used, which I find quite amazing. We have people calling for a sensible and proportionate response, sir. And I would 100% agree with that. We should have a sensible and proportionate response. But what I find ironic, sir, is the people who are demanding it are the very same people that sat in this assembly 2 years ago demanding a hysterical and over-the-top response, where we closed all our borders, where we shut everybody out, where we effectively isolated ourselves away from the rest of the world. And in doing so, of course, we would have trapped many people on the other side of the channel. So it's interesting now that they are looking for a sensible and proportionate response. And I'm glad to see that they have slightly shifted their view and accept that the pandemic is being handled in a correct manner now. The other word we had was nuanced, sir. Again, people have short memories, because if you go back to Christmas 2020, we tried a nuanced approach where we had these various rules. I personally disagree with them: 6 here, 4 there, 2 the other. It was supposed to be nuanced to try and help. It failed miserably, and we were told the public did not understand those rules. That's what we were told by people in this assembly. Now we're being told the public understand absolutely everything and we should move to nuance. What is it? Do the public not understand things, or do they understand things? The assembly needs to be clear on that, sir. The other thing that I'm rather objecting to in this debate and in yesterday's debate is this sustained attack on civil servants. The civil servants in Jersey, sir, the vast majority do an absolutely fantastic job. And in COVID, they've done a brilliant job under the most difficult of circumstances. Even if you look from a health angle, who have really come under flak here, they've done a fantastic job. Look at what has happened from a health perspective within it. We had a reallocation of GPs. That wasn't easy to do, but it was vital to do at the time. We had a vaccination rollout that perhaps has been as good as anywhere you will find in the world. We had a Nightingale hospital that was assembled incredibly quickly, partly because we managed to get out of the way of planning and the normal neighbourhood objections that we get on anything which we try to do, including building housing, sir. We had medical deliveries delivered door to door. This all came from civil servants, sir. It was politically driven, sure it was. Same as the co-funded payroll scheme, which I had a major part in bringing, as did the Treasury Minister. But we didn't arrange for it all to be done in a matter of a month, to go out, to be delivered, to be funded. The civil servants did. So can we get away from this massive attack that we see in this assembly and have done for years? And it has fueled an attack in the press on people who are doing a jolly good job for this island to the very best of their ability, sir. And the third point I would make when listening to this debate and the debate we had yesterday is the thing that's coming through loud and clear, sir, is we do not have the correct facilities in place. Whether it's to deal with this COVID at the moment in the hospital, we could do with a full isolation wing, or whether it's to do with the replacement of Samurai Ward, where we could do with the most modern rehabilitation facilities that we could possibly provide. We can't do it where we are. We need a new hospital. That has come across loud and clear. And yet the same people making these arguments yesterday, sir, are the same people who voted against the funding for the new hospital, sir. Now, I will just return to this, sir, whether I can support Deputy Tadier or not in this. I perhaps will, but I want to see what the Health Minister has to say. I feel there must be a way of arranging some sort of testing facility where we can do it. If there is not, though, sir, we must go with what the health authorities and the clinicians are telling us. It could even put more people's lives at risk if we don't, and we have to go with medical advice. We are not doctors. Thank you, sir.
Thank you, Deputy. Deputy St Martin.
Thank you, sir. So on the face of it, this proposition is perfectly supportable. Who wouldn't want to do whatever we can to help and support those close to us who are in hospital? But so I fear that while allowing people to, those people who have shown they've tested negative for COVID into hospital, I think we need to think a little bit bigger and a bit more long term, and I'd ask members to do that for a few minutes. The proposition says and mentions people who do not have COVID-19. But I don't think any of us present can be 100% sure in our hearts that a negative lateral flow test is actually saying that. We know, I certainly know, people who've tested negative on a lateral flow when they were positive, and vice versa. I also know, sir, like many others do, I suspect, that the attitude of some of the community, in our community, and I say some, because it is some, more than ever, sir, people are choosing to ignore a positive test or just not test at all. And they're doing that in order to travel or to circulate in the community in order to avoid being inconvenienced for whatever reason. And despite most people masking up, testing, having vaccines, having boosters, we do so have more in the community now who are not following the rules. So there's a risk to that. So I agree with Deputy Wickenden on one point. Prison is not hospital. Obviously, there's a massive security difference between the two physical places. But prison is not full of sick, ill, at risk, or vulnerable patients whose metabolisms may well be at a low ebb. So it's not a comparison I would choose to use. At this point, sir, I just want to say that those comments on palliative care are so well made. Those of us who are, or those people in their last days with us, should be allowed visitors. That's absolutely clear to me. So I would take them out of the considerations today, but I would ask members to think on this and allowing visitors into hospital where the decision to do that increases the risk to patients, all patients, other patients, not necessarily our own patients. It increases the risk of those people catching COVID and the potential for them then to get more ill, really ill, or worse, sadly. Surely that can't be right. So I know only too well how lockdown affected those who live alone, the elderly, children, but the elderly particularly, how they were affected by lockdown, how they lost their structure because they couldn't meet people, how regular weekly events, the events that give us all the framework of our daily life, how those events were lost, how every day was the same, how people lost track of what day of the week it was, of weekends. But so we got through that. We put up with that short-term pain for some long-term gain of being able to actually come out of the other side and get back to resuming normal life. Well, hopefully normal life in the very soon. And that's where I am here, sir. I'm not sure that I can agree to something that is great in the short term, but leaves all patients of all ages, from babies right through to the elderly, at greater risk of getting ill. Not being able to visit loved ones of whatever age who are seriously ill is awful. That can't be denied. It wrenches your stomach, it gets you in the heart, not being able to be with them, to cuddle them, to comfort them. It's awful. But so it's not as awful as never being able to visit them again, not being able to have them around again. Deputy Pershaw put things so much better than I can, and the ability or not to access A&E with children or with loved ones is challenging beyond belief, but deciding which parents are allowed into A&E and which not needs the wisdom of Solomon, sir, and staff are put in terrible positions trying to choose. How ill is the child? Is it a broken bone, or is it something really, really serious, something which can't be fixed in the short term? Which children can cope without their parents in A&E, or without both parents in A&E? But having said that, which parents can cope without accompanying their children? Because some will do better than others. And the moment you say yes to one, should you then be saying yes to the next? And it goes on. And subjectivity is such a difficult thing. So this is absolutely, as Deputy Doubilet so clearly put, this is absolutely not a monetary thing. Nothing is more important than family and loved ones. But we need to be sure that those who are already ill, because why else would you be in hospital, are not made more sick. I end with that, sir. Families want and need to be together, but they need to be together for the longest possible time. And in my mind, sir, far better to have some short-term pain in not being able to meet next week, and to get some long-term gain in being able to meet, to see, to talk, to hug, to love next month and next year. I could speak more, sir, and I will listen more. But right at this point, I'm not sure that I can agree to something that increases the risk to patients, to all patients. And it's all patients that we need to think of, everybody in the hospital. I need to be sure that what we're dealing with here is safe and robust before supporting it. So I'll wait to hear more from the Minister and others. Thank you, sir.
Thank you, Deputy. Deputy Ward.
Thank you, sir. And, I think the majority of people who've spoken, it's been a really thoughtful debate, and I do thank Deputy Tadier for bringing this, because it's really got me thinking as well, as to where we are. And so what I would like to do is to bring us back to the actual proposition as is written, and perhaps highlight a few areas. It does say people who do not have COVID should be allowed to visit people in hospital, and services to instigate a robust system to keep people who do not have COVID from visiting the hospital. Now, sir, that to me strikes the key point of that is there is what might refer to as a burden of proof needed before you visit the hospital that you do not have COVID. And I just try and reassure the last speaker. I get the point regards, can we ever be certain about testing? But there is a point where we have to have some reliance on testing for our society. I too take lateral flow tests before I go to any events and before I go out and about and meet constituents or go into school or anything like that. And I am reliant on the fact that I've done that well, and that people are protected by that. Because if we don't have that, and that is not a system that's working, then we have a real problem for our society in opening up in any way. So the systems that we have to rely on. I think that the robust system needs to be looked at as well in terms of where it's applicable. This is about visiting people that are admitted to hospital and are ill. And I think there is a simplicity, and I think it's become overcomplicated in this debate by some. I don't, hopefully not purposefully, because that's not the type of debate we need on this. In that we're not talking about those who are going for a blood test, who are visiting the pharmacy, who are perhaps going for an outpatient's appointment after a broken bone or to have a cast removed, etc., etc. Those standard safety measures exist in terms of mask wearing, washing your hands, and there is somebody on the door that you go past who checks whether you have any symptoms on your way in. I've done it myself recently. This is about visiting those who are admitted onto particular wards that are away from the main area, that area of the hospital. And I think so a robust system could be simply to put to anybody who wants to visit, and you perhaps booking visiting times, is that in order to visit the hospital, you need to provide this type of proof. Otherwise, you will not be admitted to the ward. And what that does, sir, in addition, and I think it's a point that nobody's made yet, is actually gives a level of safety to staff that they currently don't have. Because there is if staff are having to go to the entrance to the ward, speak to people who are just appearing, they are putting themselves at risk in that interaction at that time. And so there needs to be, beyond the visiting, there needs to be a more robust system in place for the staff around those wards and the staff who we are expecting to put in the front line all of the time and have done so throughout this pandemic. And so I think that any system that's put in place to protect against the spread of this disease by testing previous to going to the hospital will be beneficial, full stop. And I note, sir, that in the comments that were circulated to us from the Minister, and I thank him for those, it says in the penultimate paragraph, I have urged that we make every effort to overcome the operational challenges, and we will continue efforts to establish a robust system with a view to admitting visitors through a safe process. Now that you can infer for that at the moment they don't have a safe system. We must continue to be advised by clinical leaders who bear responsibility for the safety of the patients who are the most vulnerable in our community. And so I think we would agree with that. So to some extent, I think there's an agreement here with the Minister and everybody who's speaking to say that actually what we're lacking at the moment is a robust system in the hospital for visiting. And then we have a choice. We either put that robust system in as per this proposition, and I hope I'm making this argument pertinently, because it's a difficult one to make in some ways. So we either put that, and this proposition could be a catalyst for making that happen, or we never have a robust system. And so when does the ban on visiting end? Is it to do with levels of infection in the community? At what point is that going to be? We've been there before, and we're uncertain about that. And so throughout, as long as this pandemic exists, we are going to need some form of robust system in our hospital to protect staff and protect patients. And so this is an opportunity to do that with all the support it needs. And if it is a problem with staff in the hospital, then we need to look at allocating staff to this particular place on our island, the hospital, with the most vulnerable community, to protect them. Because so we can do it. And it was very interesting as I look back through the COVID reporting emails that we get every day. From yesterday's, we have the total number of tests that have been performed on the island, mainly for inbound travel and online screening surveillance since the beginning of the pandemic, is 962,506 tests. So that's a significant number, and nowhere near that number will be required to make visiting the wards of the hospital safer than it is now and safe into the future. And I think that's a context we need to look at. We are putting this into a proportion which isn't there and is manageable. It also gives us the opportunity to reset the button, if you like, and say to people who are visiting the hospital, look, you have a huge responsibility here. We want you to be able to visit your loved ones. But the deal is, and it's something Deputy Doublé said, and I totally agree with her, that you will take a lateral flow test. And if you cannot provide that proof, you'll do that on the door and wait your 10 minutes. Because I certainly, when I was visiting people in hospital, loved ones in hospital without an operation, I certainly would have done that in order to ensure that I could access the hospital. And I think the vast majority of people on the island. Plus the government, and we are heading down the line of saying to people, actually, as we learn to live with, and whatever that means, the pandemic, then it's up to individuals to take responsibility. But at the first step, where we need individuals to take responsibility and provide proof, we're saying, actually, we can't do that. We're going to have to shut down visiting to the hospital. So I think this is an opportunity to provide better protection for those who are working at the hospital, better protection for those on the wards themselves, and a more sort of thorough provision of visiting from loved ones. With it, within a time scale that is not just something that's open-ended. And so I hope that people can support this proposition for those reasons, and not get drawn into this extension of issues and this clouding of this debate into areas of criticism of civil servants. I don't know where that came from, criticism of the hospital debate and so on. So it's nothing to do with all of that. This is really simple. A blanket ban has been introduced. I think the majority of the Assembly are saying really that's not the way to do it because it's causing more harm than good. But we need a robust system to protect staff and members of our community who are in hospital at the same time. So can we go away from this debate, please, and get on with that and give the support where it's needed? I think that's the simplicity of this argument, and something that we have the facility to do with lateral flow testing, PCR testing, and vaccinations. I'm treble vaccinated. I lateral flow test every day because I want to go out and about and do as much as I can that I'm allowed to in terms of safety for our community. I can do that. Others can do that. It's certainly possible for us to instigate, and I hope the Health Minister will see that and support it. And I urge members to support this proposition. Thank you, sir.
Thank you very much. Deputy Martin.
Yes, thank you, sir. And it does sound very simple, doesn't it? When this request came to COM at the end of our normal meeting last Tuesday, we were asked, because of suddenly the numbers had gone up and it seemed to be possibly people that had come in who were, Deputy Ward asked very politely, have you had a COVID, done your lateral flow? Yes, it's negative, but either they had done it on the wrong day or maybe not done it right, but COVID got in, and once COVID got in again, it started spreading. We all know Omicron spreads more than anything. It started spreading. Now, I know the Chief Minister and the Health Minister have been talking to all the medical staff to overcome this, you know, get this robust system in. But I also took an offence about Deputy Doublé saying, oh, if this was a finance centre or something, we might be able to do it. This is the one, remember, the one hospital we have in Jersey, the one set of medical staff. We also have people going in there daily for chemotherapy, saving their lives, literally saving their lives. They may use one of the toilets as they're going in or coming out, where somebody else has visited who has got COVID and hasn't done the test or is carrying COVID. So I didn't think at the time that it was too much to ask. Look, we need to close some of the wards off. We would definitely keep maternity open, and we'll keep end of life visiting, as we would do as much as we can. But for general visitors, we have to just pause for a moment, maybe a week. Let's see how the numbers go, and we need to get the numbers down in the hospital, and we need to keep people safe. Deputy Ward just said, you know, and him and Deputy Doublé, very, very good citizens, would just say, yes, I'd sit in a room for 10 minutes and I'd have my lateral flow, and or hopefully you'll be sitting in a room on your own and there's no one else in that room who tests positive, because then what do? They send you all home. And how many rooms does the hospital need? You've seen the facilities in our one hospital. They're not the greatest. They manage with what we've got. And, you know, I said at the meeting the other night, we need to try and get a system in place, but I would only support it for all the reasons Deputy of St Martin said. It may be a short-term pain, but it's got to be a long-term gain. I can't have people mixing up there. They can't go anywhere else, sir. They literally can't go anywhere else. And look, you know, Deputy Taddeo again compared the prison. I know this has been said, but it's a totally different environment, and COVID's in there now. And they're thinking about stopping visitors. Guernsey prison's full of it. They stopped visitors 2 days ago. The only sensible thing, and they are searched, they know, you know, the time they're going in, etc., etc. The visiting hours at the hospital are brilliant. You know, they work around people who work. There's quite a lot of hours. There's lots and lots of people. There's lots and lots of entrances, if you really think about it. And it isn't the good islanders who really want to see their people in hospital. It's the people who are rude, and sometimes very rude, to young nurses who have just qualified, and they don't need this. They are busy, they are tired, they've done a long day shift, and then they get abuse because a policy that we've put in, and that was a very, you know, have you had a lateral flow? Are you negative? So I know that it's very easy to say allow people who do not have COVID to visit the hospital. It's absolutely no-brainer, sir. It's how do we determine the people who don't have COVID? It probably, to me, can't be on site. It just, but I don't want to go down to what, you know, inventing a system. But it's going to be, I think what Deputy Taddeo said when he opened up, it might be something a bit, at the moment, people might think it's a bit over the top. But if we can do it, I will listen to the Health Minister. I've read his comments, and I know they are absolutely talking to medical staff, and there's suggestions, and they're trying. And they both said very late on Tuesday night, we are trying, and we will do it if it's safe, and it must be safe for everybody. And I'll just finish again by saying we can't send patients up the road. We don't have another hospital. We have our staff. We can't afford for any more of them to get sick. So I'll listen to what the Health Minister says. I've read the comments, but as I say, there's just so much that hospital does. It does everything for a population that would have about 400,000 people, as you know, very sick people who are getting life-saving treatment in there. Don't want them mixing with people who flaunt the rules, and I'm very sorry. But I'll listen to the Health Minister, sir, and then I'll decide which way I'm going to vote. Thank you.
Thank you very much. Constable of St Clements.
Sir, thank you for allowing me to speak. This is very difficult for me. I'm not a great speaker, and I only speak when I think there is a great need. I have a story to tell. It's very personal, and if I break a little bit, I hope you'll understand why as I tell the story. In 2020, I spent many months in oncology. I had 12 rounds of chemotherapy, and I abided by all the rules, and I was frightened, extremely frightened. COVID hit at exactly the same time, and so I spent the intervening times between my rounds of chemotherapy at home alone and suffering dire side effects. I experienced firsthand what old age feels like. The side effects of freezing cold, numbness of hands, legs and feet, made you trip over for no reason whatsoever. I collapsed twice. I went back for more. I was told to stop at 8 rounds. I insisted on continuing to make sure as many of these little aggressive cells were got rid of as possible. In the intervening time, at the very early stage, COVID struck, and I spent many times visiting with my masks on. In the early days, COVID was unknown and people were petrified, and the hospital situation was incredible, absolutely incredible. I saw consultants go on the ward when they're off duty, helping an unknown quantity and facing danger because their Hippocratic oath says that they must look after the sick despite the consequences. And we've seen that worldwide. So I did my duty to myself and to my family. I told my family that Dad would do his best to come out of this and would do anything that was necessary to stay alive. Dad had 3 operations in 2021. In the first one, I ended up with a stoma bag, which is a terrible situation for anybody to face. And I know that many people have them permanently. I know one lady who has had it for 30 years, and it's the most incredible situation to be in. And again, you feel as though you've taken a step backwards, but you have to stay focused. All around you, and this is the point, the staff in the early days were facing an unknown quantity, but they came to work. They looked after us. They went above and beyond. And I continued to follow the rules. Visitors followed the rules, and everybody was scared. After my first operation, and I had the stoma bag, I later had a reversal, and that was great. That was fantastic. But on the day that I was due to leave from my operation, I'd spent 8 days in hospital with limited visitations because of various circumstances as they transpired in the hospital at the time. And sometimes I could be visited and sometimes I couldn't. But you have to accept that. It is the hospital. You have to go by the rules that the clinicians set. They are the experts. And how dare we argue with them to the extent that we put other people in danger? On the day I was due to go home, my wife came to collect me. I was fully dressed and I went into some enormous shiver. I'd contracted sepsis, another set back. And I wept. I'd heard about sepsis. Some people end up losing limbs because of sepsis. I went down for an emergency scan. People were in the masks. I was in my masks. The porters were in their masks. Everybody was doing their hands. And I went down, and the guy was there. It was about 8 o'clock at night, and they were very gentle with me, and I was petrified. And they did their scan. I went back home on the ward, and I had some special medicine, and I had paracetamol, large doses of paracetamol to get my temperature down. And 3 days later, I left hospital. And then we have to go through other operations. But the basis of my story is this. We are at the final hurdle of the COVID cycle. We hope, we think. We don't even know whether the next person coming in through the hospital door has got Omicron or the next variant. Why are we so stupid as to allow people to come in saying, or we think that they might be COVID free, when the gestation period for COVID is 2 to 5 days in any case? So anybody walking through the door, whether they've had their lateral flow test or not, might still have COVID. And there just might be a 0.001% chance that that next person coming through the door might have the next variant, which might be 10 times worse. I wholeheartedly agree with the empathy expressed by various speakers previously that there is a huge need to have your family by your side. And I missed that for hours and days on end. But the governing picture is this. You have to look after the general populace. We are the arbiters of the civil service and the great consultants that we have at the General Hospital. We fundamentally decide whether they're right or wrong. But you can only be, I don't know why we would risk going against their advice at the final hurdle of this major 2-year worldwide pandemic. I owe my life to Doctors Duku, Dr. Kasai, and Dr. Sumal. I saw some of these consultants on wards when they weren't on duty in the early days of COVID because they wanted to do more. There were shortages. So these guys went about their business facing an unknown quantity in early 2020, and I think they need to be awarded medals. But I think we are endangering knocking the final hurdle down and falling flat on our face. And whilst we need to allow various sections of the community access for palliative care measures, children and maybe A&E, etc., we must make the greatest precaution. The greatest way of protecting the people in hospital is to not allow this proposition. As emotionally charged as it is, my experience pleads you to say no and allow this to take its course, which I think is probably only going to be 2 to 3 weeks from now. Thank you for listening.
Very much, Quintar. Does any other member wish to speak on the proposition? Senator Meze.
Thank you, sir. I have to say that I'm very surprised that the proposition as it's worded is causing such controversy, because I think that it is worded extremely carefully to make absolute sure that the Assembly is not placed in a position where we vote to act contrary to medical advice or to change circumstances to puts people at risk from contracting COVID and making things worse at this part of the pandemic. And if the proposition did leave any wriggle room for that, I would not only have not been prepared to vote for it, I would have tried to convince Deputy Tadier not to bring it. But he has brought something that is worded very carefully to make sure that it's not those things that I think some members who've spoken seem to think that it is. The proposition does not prescribe exactly what needs to happen from this point. The key words in it are the words "a matter of urgency." That's actually what this is about. It's about determining whether we think the situation now where some very vulnerable people are having their health and well-being affected by the restrictions there are on them receiving visitors to go and see them, needs to be whether that needs to be considered urgently or whether it needs to be considered at leisure. That's actually the point that we're debating here. We're not debating opening up the hospital to anybody who wants to go in. We're not debating prescribing a specific regime to determine who's allowed in and out. We're saying that the Minister for Health and Social Services should instigate a robust system, and in doing that, he'll consult with whoever he needs to make sure that we get that robust system. And if that robust system is not ready in a particular time frame, the proposition does not ask the minister to go ahead anyway. It simply uses the word urgency, so it can be done as quick as is possible, but not quicker than that and not slower than that. And I'm surprised that that provokes such controversy. I, for one, want to make sure that every member of staff in our health service, every patient receiving care in our health service, and every visitor who attends health facilities is kept absolutely safe from COVID. And I'd like the minister to do what he can to make sure that there are systems in place which weren't in place beforehand that had led to problems. Make sure those systems are in place so that those who are in hospital and who are alone and worried and potentially even scared can have the comfort of the presence of those who they care about around them to help them through that and help them through their treatment or their recoveries. And that surely is something we can all get behind. And this proposition in asking the minister to go away and do that work gives him a green light and gives him an endorsement from this assembly to say that we think this is important enough to deserve serious consideration, rather than what was a knee-jerk reaction in all of a sudden banning visits because of problems that have arisen. And I'm not deprecating the minister for doing that. When problems arise, sometimes you do have to resort to a knee-jerk response to immediately put a stop to that problem. But then the question is, do you maintain those restrictions without a second thought beyond the initial knee-jerk reaction, or do you consider them carefully and quickly to try and improve the situation beyond that? So, I would urge members actually to unite around this, because nobody, I think, is actually is at odds in their purpose here. We want things to improve for patients in the hospital, and I would hope we want to do that as soon as possible. The Minister for Health, who hasn't spoken in the debate yet, unfortunately, but will be just after me, I see, has in some of the emails that we've seen and in the comments we've seen, shown actually so far an openness to this proposal, and has expressed views on certain options that could be before him to enable visits to take place again and to be able to take place safely and effectively where there is no risk. So clearly there is some thinking that's already being done on this, and therefore giving him the green light to go ahead urgently on this and cause us no harm. And if there were a risk of this proposition causing harm, of enabling visits at an arbitrary date and without a robust system in place, I wouldn't even be considering voting for it, because that would clearly lead to greater risk and potential harm to staff and patients and even visitors alike, which we want to avoid. And I guess the final point to make, and I make this not to score a point, but I think hopefully to help in our thinking of how we hopefully move towards the end of the pandemic. But Deputy Ash did say in his speech that he found it ironic, or words to that effect anyway, that some of those who in 2020 had been arguing in favour of tough restrictions, and in particular had argued against opening the borders because of the increased risk that potentially posed at the time, are now arguing from the opposite angle, arguing for less restrictions. And I think there's a serious point here that needs to be understood if we're to move out of the pandemic in a safe and sensible way, which is that where the world is now in January 2022 is totally different from where we were in March to June 2020. Arguing for tougher restrictions at the start of the pandemic made sense because there was little to no protection from the virus in the form of a vaccine or the drugs that are now being given to people with COVID to lessen the harm that it does to them. Now at this point we have both of those things, and both of those things are our route to getting out of the pandemic and leaving this as endemic and enabling us to eventually go on to normality and to be able to live our lives normally as we did before this era. And that requires a change of thinking. The toughest restrictions that we faced on our liberties early on in the pandemic were necessary, but we can do better than that now because of the scientific advancements that have been made in the development of that vaccine and the development of the anti-COVID drugs as well, which means that you can lessen the risk, you can be more sure of environments being safe than we could have done at that point. And if we can get to a situation where our responses to spikes or particular emergencies which might take place in particular environments, we can make sure that our response to that is one which does maintain a risk-free environment, but enables people to take part in our economy, to visit people, to try to have as much normality in their lives as possible. Is that not the preferable option because of all the impacts we know that tough restrictions have on people's mental health and well-being, and the consequential effects that has on their general health and their recoveries? So I'm eager to hear what the Health Minister has to say after this, because in his comments he left it open as to whether he could support this proposition or not. But I just want to attempt to cool the debate that was starting to get heated beforehand, to point out that this is not about trying to increase the risk to patients and staff in the hospital, but about the key point of treating this as a matter of urgency, not a matter to be dealt with at leisure, and to say that it's important enough for the solution to be found to this as soon as possible, rather than having a relaxed approach and potentially leaving people facing that hardship for weeks and weeks to come, rather than having it dealt with quicker with that robust system in place so that nobody's put at extra risk. And I struggle to see how anybody can disagree with that, unless you are genuinely of the opinion that visits to people in hospital is not important. And I would hope that most of us would think it is important and worth people thinking about very seriously to make sure it can be enabled. And I would like it to be enabled, and that's why I'll vote for the proposition to say to the Health Minister, please deal with this urgently and deal with it so that those people in hospital can benefit from the emotional support that they'll get from visitors to assist with their recovery, and do so in a way which poses no risk to anyone. We can achieve that, so let's get on with it. Thank you, sir.
Thank you very much, Senator. Deputy St Wong.
Thank you, sir. So I want to thank all those who've contributed so far to this debate. Once again, hospital services are in the spotlight, and I thank members for the consideration they've given to staff, what they've said about the dedication of staff. I particularly want to commend the Connétable of St Clement for his very moving, brave speech. The best speeches in this house are always the ones that come from the heart, and in HCS, as I'm sure we all do, we love hearing those patient stories when they are so positive, and we know there's that positive outcome. So I thank the Connétable for feeling able to share, and I thank him for his remarks about our dedicated, hard-working staff who were facing, as he described, those perils at the beginning of COVID, but yet they stepped up and did what we asked them as an island to do. So to come to Deputy Tadier's proposition. Yes, of course, all of us, all the hospital staff would wish to get back to allowing visitors into all wards. But please, we've got to recognise that in our charge, we have some of the most vulnerable people in our community. And infection control is an fundamental part of a hospital organisation. It's a constant presence in everything that is done, but it's not terribly visible when we go and visit. It's not obvious, perhaps a little more so during COVID, but normally so much planning and organisation has gone on in the background to keep patients safe and to limit the spread of any sort of infection. And most times that can be managed allowing visitors in and allowing a free circulation of people. But sometimes circumstances mean it cannot. And it's a standard procedure in hospitals when the infection risk tips the balance between the risk of infection to ill and frail people who might get that additional illness or even die, when that outweighs the benefits of allowing visitors to give emotional support to their loved ones. And it's a hard decision to make when those circumstances arise. It really is. And I want to assure members that those who've been responsible for this decision, the clinical leaders, are not callous, they're not harridans, they're not seeking to protect themselves. I want to read the comments made by the chief nurse, our chief nurse, when the limited restrictions, not a blanket ban, limited restrictions were introduced. She said, "We are a small hospital on an island. As such, we take infection prevention and control incredibly seriously in all of our services. Our priority is our patients, to ensure their safety while they are in our care, and to the health and well-being of our staff." That's what she said, and that remains the priority. Safety. Safety for patients, safety for our staff. And therefore, sir, I don't think at this stage, because this is a temporary restriction, it is not a human rights issue. This is a standard operating procedure in all healthcare systems. It's used sparingly, but it's used when it is essential to safeguard life and health. And I'm surprised, sir, that the proposer did appear to criticise me for not preventing infection in the first place, for having a regime where people can wander around the hospital. I would have preferred that he would have criticised irresponsible members of our community who came into the hospital knowing they are symptomatic. How could they have not thought that they might well be carrying COVID, who subsequently tested positive, who we know, you can never know 100% perhaps how anyone catches COVID, but we do know what measures staff take to protect themselves. We do test all the patients in hospital. So we could tell to a very significant extent that it was not brought in by staff or patients already in the hospital, because those patients had been there for some time and had been tested. Who were recent visitors? Well, it was the visitors that were most very likely to have brought it in. And of course, they are a small minority of visitors, and they've spoilt it for the rest of our community. But it still remains the duty of our clinical leads to protect against that small, irresponsible minority. And it's unfortunately the case that the majority suffer, and our clinical leads should not be blamed for that. We all have to adhere to rules in society, to obey laws, because they're needed, because a small minority would otherwise refuse to obey laws. We don't say that we should abolish all laws and find other ways to sort out those sort of things. So, sir, our clinical leaders absolutely are seeking ways to restore visiting as soon as possible. It is not that they are not supporting visiting, because they certainly are. They are, and this has been done from the beginning. All options have been considered. It's all very good to say, oh, it's entirely possible to devise a system. When better fixers, logistical experts and the like, and I have looked at it and not yet found that system. If Deputy Tadier has any ideas that would not have been thought of by all those sort of practical people, then let him come forward. But the issues, the problems have been identified by previous speakers, especially I think Deputy Martin, of space. You know, the hospital is a crowded place. We have hundreds of people visiting in normal times. They would all have to be corralled into a space, tests administered, socially distanced. Difficult to identify that space because there's an outpatient waiting room. But what happens? Do we cancel the outpatients? No, of course not. And then what happens if somebody tests positive in that space? Well, first of all, receiving that news, it can be a shock and distressing for some people. So we'll need staff, clinical staff on duty to help that person through. We'll need to take them away to somewhere else in the building and help them through the PCR test and everything else they need to know. But what about the people next to them? What does that mean for direct contact issues? There are so many issues to think through, and the provisioning of it in terms of staffing. When I don't want our clinical staff to be diverted from their duties to do this, and other people are saying that, of course. So is it easy to draw staff from elsewhere within government, or to buy in contractors who would do this? No, it's not, because those questions have been asked. And across government, I understand that workforce is down by about 10% at the moment. Not just government, but in private sector. And so we know that the constraints on just getting a team of people in, training them to do this safely, and just making this work. But we will continue exploring all options and asking people to have a look again. And no doubt they're, you know, the clever people who plan these sort of things have thought of all sorts of issues and tried to get over them. But the advice that has come up to me is that they're still thinking, they're still trying, but at the moment it's not being possible. And I shouldn't expect that something is going to be dreamed up in a day or two. So I mentioned staff, and the Constable of St John has asked me also about staff, and I should say I came to this debate ready to answer Deputy Tadier's proposition, but I find it's question time, and that's fine. I will always try and answer questions, but I'm sorry I've had to delay, because some of these were deeply operational questions, and not the sort of questions that would normally be asked without notice. But to the Constable of St John, there are presently in HCS 141 staff that are absent due to illness. 58 of those 141 are for COVID-related illnesses or reasons. So the 141 represents 5.7% overall absence in our staffing. The 58 represents 2% of our staffing. And those are not separate figures. The 58 are combined in the 141. And I can say those levels are coming down. They have been coming down over the week, as we might expect, as infection seems to be reducing. I hope it is continuing to reduce in the community. And the Constable also queried again the percentages given on the vacancy rates. We I think, as all government departments do, calculate vacancy rates at least monthly. So it's no surprise that if you ask at different times, there are different rates. And I don't see why this has been a criticism. I was also asked, can I say that I was really sorry to hear about the experiences of Deputy Pershard and her family, and I can put her in touch with people better than I, because I'm not trained in these things, who can answer all detailed questions. But I can give some details at the moment if I can just access an email. And I'm also answering, I think, questions asked by Deputy Dublé. So the regime in the emergency department, when a child comes in, is that we ask for only one parent to accompany that child. And the rationale behind that is to prevent crowding in a clinical area. And that's, as we had said in previous public health guidance, if you think about it, it's the same reason why at the height of the pandemic, we asked and introduced social distancing in places like supermarkets, because we needed to prevent crowding in areas where infection can spread, and especially in a clinical area. But we have allowed in more than one parent or additional relatives in exceptional circumstances. And I'm told that one of those exceptional circumstances has been an end of life. Or that might, I don't know whether it's happened, but that's in the protocol. But God forbid that children should be facing end of life issues. In the maternity ward, I've got quite a, right, those visiting are asked to take an LFT test before they have antenatal visits. In elective care, for example, cesarean sections, PCRs are given prior to the procedure. For women coming in labour, there are rapid PCRs for them and their partner. I'm conscious this is great details, sir, but it has been asked of me. And it may be more than what I was asked, but staff have tried to understand what is being asked. In postnatal, the birth partner is allowed to visit because they will have had a previous PCR. There's the LFT test before seeing midwives, pre and post. That is the mother and the partner. On the maternity ward, one birth partner is permitted. The note says plus one other, one birth partner plus one other, but it must be the same individual or named person for the whole stay. There has to be an LFT test taken prior to the visit, and staff will ask to see the cartridge. For scans, an LFT test is required on those attending the scan, and a partner can also attend. In SCIBU and pediatrics, two parents can attend, but they must visit one at a time. They must take a daily LFT test and bring the cartridge with them. Insofar as concerned end of life, sir, end of life situations have allowed.
I'm sorry, we're moving on to end of life. I've been waiting to find a gap. This might be it. Would you give way for a point of clarification from the Connétable St John?
Yes, I will, sir.
Thank you, sir, and I thank the Minister for the helpful information about the level of absences caused by sickness. So the question about the numbers, one figure given this Assembly was on the 2nd of November, 135 people, a figure on a freedom of information.
Does have to be a point of clarification. Are you asking the Minister to clarify something in his speech?
Yes, sir. He says the numbers are from different months. The numbers I quoted were from 1 day apart, sir. 1 day, not months, 1 day.
That's not a point of clarification. That's a speech point in response. I'm afraid, Councillor.
Thank you for the opportunity.
If you want to clarify what you were saying, Minister, this might be a good time to do it.
Well, sir, I'd like to clarify, but obviously I've not been able to prepare for that question. It's an issue around statistics. I wouldn't have an answer, but I would be pleased to work with the Connétable to try and work this through and understand what has happened, because maybe it depends how the question was asked as to the answer that was given. So let's take this out of the Assembly and we'll try and work this through, and I will do my level best to do that. Sir, I acknowledge I'm sorry, sir. I would be the principal responder here, I assume, so I don't have a time limit. Is that correct?
You're the principal responder, of course.
Thank you, sir. In end-of-life scenarios, sir, more than one person at a time has been allowed to visit, and the Deputy Chief Nurse who sent me this email confirms that the staff have certainly been facilitating visitors in the end-of-life scenario, and also for recent diagnosis, and on some occasions to be there at that diagnosis. Clearly, clinical staff would want to try and preempt the giving of significant news with visitors, but it's not always feasible or appropriate. Some patients want the opportunity to take stock on their own, for example, and then share when they feel it is ready. So it confirms again that they have facilitated visiting for also for positive relatives with visiting and for legal processes where, for example, a power of attorney needs to be given, and for dementia patients needing help for feeding, where the knowledge, the recognition of the carer is proving crucial to nutrition. So I should make clear, if I may, that a palliative care pathway does not immediately mean an end-of-life scenario. It is possible, and indeed, because of advances in palliative care, when it is recognized that somebody will die as a result of a condition, they are put on a palliative care pathway immediately. That doesn't mean that there's no treatment given, doesn't mean that they might not be healed or go into remission, but it is recognized that that is a condition which can cause death. So being on a palliative care pathway can be a long-term measure to ensure that the correct care is given to a person. It doesn't immediately mean that somebody is in an end-of-life care situation. And that may be where some confusion is arising, because and obviously I acknowledge that it is not possible for even highly trained staff to know the precise moment when somebody is dying, and so it's not an easy scenario, but staff will have the best judgments they can give as to when somebody is at end of life, and using that best judgment, they will be compassionate. I can assure members they will be compassionate, and they will allow appropriate exemptions. And so, as Deputy Tadier told the Assembly, he'd been contacted this morning by somebody whose relative appears to be on the palliative care pathway. But he contacted me also before the debate, and I've asked him for the name and the ward the patient is on. I haven't yet had that information, but it's frustrating to me that, and I said this yesterday, that people are telling me, Ranulph, your organization is failing. I've got loads of evidence, but I'm not going to tell you what it is, or who it is, or who's been speaking to me. Now that might not be the case of Deputy Tadier. He might be going to tell me soon, I hope, that the name of this patient, so that I can make inquiries, because I always will make inquiries. If members want to tell me that patients or families are raising concerns with them about our care, I am willing to ask questions about that. I'm willing to go to those who are caring and say, have we got it right? But I'm afraid there are some members who are saying, I'm just gathering evidence. I'm getting all these accounts, and I'm not going to tell you who. And how does that help me?
Minister, Deputy Tadier is asking you to give way. He hasn't said what he wants you to give way for, but I imagine it's a point of clarification. Is it, Deputy Tadier?
I will give way,
yes,
sir.
And is a clarification of your speech or of something the Minister has said?
It's about what the minister said. Does the minister accept that this isn't that the person in question, of course, contacted me this morning, and they are dealing with that as best as they can on the ward, trying to access to see their relative. But does the minister? He's told us that people with palliative care and relatives will be allowed to see relatives, but in this case they've not been allowed. So does he accept that the policy is failing, and it shouldn't be a case of contacting a states member or the minister to be able to see your relative?
So I'm just checking what we have said about exemptions first. So when we announced this, we said exceptions will be in place for people receiving end-of-life care. And that's the distinction I'm trying to make. There are very many patients on a palliative care pathway who can be on that pathway for months. It does not mean they're yet at the end of life, or that even that they might reach the end of life because they might come off. Sometimes they do come off the palliative care pathway. I understand. I don't know. I don't know the detail. So there is a distinction between end-of-life care and palliative care. Palliative care is a process. So because somebody says their relative is on palliative care, they may not be in danger of dying on the ward. But that's my difficulty. And unless I can make inquiries, I'm stuck. I'm facing criticism, but I can't make inquiries. So please, can you either ask that person to contact me if she really feels that you know, she's got no other recourse, or to give you her name to pass on to me. Sorry, I don't know if it's her or him. And that's really only if she can't get what that person feels is a satisfactory response from the ward, because I know our ward are exercising this compassionately, and I can't speak of the individual circumstances that Deputy Tadier seeks to know about. But if that person has been told, I'm sorry, it's not appropriate for you to come in, then I can only support my staff who will have assessed that on the basis that the relative is not receiving end-of-life care. And it would be more of a risk for that visitor to come in and run the risk of infection in this difficult circumstances we're in. So that's my response at the moment, but I need some detail to investigate this. I'm afraid I just don't know how to work this. If members want a health service that responds with compassion and care, and at the same time you're putting us under pressure by political motives, is it? I don't know. Is it political moves because you're saying so much is going wrong, but you're not telling us the people you're speaking to so that we can try and put it right? And this is our health service, and it's going to be harmed if we make it a political football over the next 6 months. So I'm sorry if I'm getting emotional and distressed, but I'm really fearing at the moment for the way this is going. We need to support our clinical staff, our leaders, everybody in the hospital, and that's what we're saying, but we're running the risk of politicizing hospital services. If we believe we know better than our clinical leaders, then we just need to constitute ourselves as a committee of 49 who are going to run the hospital and put in place all the processes we want, and there'll be hundreds of them, and make clinical decisions. Actually, I don't want to do that. I would be terrified about doing that. I trust the people who are trained to do this, and I don't envy the judgments they make. At this time, well, for the last 2 years, they've been working in extremely challenging conditions that they've never known before. And they have gone through this, delivering the safest care they know, and they've gone above and beyond the call of duty. And I would just ask members to support good clinical governance, good clinical leadership, to have respect when we get that advice, and to give some understanding, some appreciation of the difficulties and the conflicts these people are trying to manage. There are no easy solutions here. Which would bring me back to the wording of the proposition when I say there are no easy solutions. But we will continue to try to find a solution to ensure safe visiting. So I feel I can support Deputy Tadier's proposition because it asks me to agree that people who do not have COVID-19.
No.
I'm sorry, if someone has their microphone switched on and there's noise in the background, would they please switch it off immediately? Please carry on.
Yes, I'm sorry, I halted there. Proposition asks me to agree that people who do not have COVID-19 should be allowed to visit people in hospital. Of course, I agree they should be allowed to visit people in hospital. Then it asks me to request as a matter of urgency that I instigate a robust system to keep those people, to keep people who do have COVID-19 from visiting people in hospital. So I will accept that request if the Assembly wishes me to, on the basis that a robust system means a safe system, which is confirmed to me as safe by our clinical leadership. And then with that system, I will instigate it to ensure visiting. And whilst we're trying to work that out, I undertake to the Assembly that we'll continue trying to achieve it. So I will support the proposition, sir. And once again, I thank members for hearing me out in what has been a somewhat difficult speech to deliver. Thank you, sir.
Thank you very much, Minister. Senator Moore.
Apologies. Thank you, sir. I'm very pleased to follow the Health Minister there. It was a bit of a bombshell to hear his conclusion at the end of his speech, and I very much welcome warmly his conclusion, which appears to be a balance of the compassion versus practicality equation that we have been asking him to reach. I do have a lot of sympathy for the position that the Health Minister is in. Of course, we all greatly respect and appreciate the efforts that hospital staff have been through over the past 2 years. It has been an unprecedented and exceedingly difficult time. Yet, the Health Minister did talk, sir, of the Assembly running the risk of politicising hospital services. And I do not want to dwell too much on this, but I do want to try once again to express to the Minister, as many of us have already tried to do with him privately, the need to listen to States members who have tried to communicate and express concerns with him. If I may, just over the last 6 weeks, there have been at least 2 statements issued by the government that have, to all intents and purposes, said, despite the Omicron peak, there's no problems here at the inn. Everything is fine within our health services. And when those statements go out, sir, there is a shriek internally from members of staff who are desperately trying to keep their service on track and feel that the government members are not listening to their concerns. And we discussed this yesterday. Well, just if I may, on that point. So we as states members get messages saying, no, this is not correct. We are in trouble. We are struggling. We are on our knees. Those are 3 quotes from 3 separate messages that have been received by me alone. And I know plenty of my colleagues have received similar. The final one who mentioned that they're struggling said in a message last week, but at least they have now implemented some restrictions on people entering hospital. So it is a difficult situation and it is a tight balance. But the reason I wish to make this point, given the minister's conclusions, sir, is that, as we mentioned yesterday, we received at the end of last week a letter from the medical director and the chief nurse expressing very clearly to states members that they had great concern that clinical voices may be ignored if the Assembly were to take actions that we were considering in this debate and the earlier debate of the week. It appears on the face of it that this Assembly is exactly where we need to be taking some of these decisions, sir, because, and it's not clear exactly at what point, but at some point in the health and community services structure, there is an internal failure to listen. And this is causing great distress to people who are doing their very best to deliver clinically for patients on a day-by-day basis. And hopefully, although we are now appearing to have crested the peak of the Omicron wave, it is important that we continue, or that we seek to remove this blockage. We seek to change the structure and to actually listen appropriately to staff when they raise concerns and to act accordingly. It is no longer appropriate to put out statements claiming that things are okay when we simply know that they're not. Just as the Constable of St John so rightly identified the disparities from one day to the next in terms of the vacancy rate, it is inexplicable that that vacancy rate could have changed to such a great extent within the space of 2 days. That simply does not happen. And so we need to have answers as to why that incorrect information has been put out, and we wish to see an absolute and concerted effort to remedy the situation, to start afresh from today and move forward. So I congratulate and thank the Health Minister for agreeing with Deputy Tadia's proposition. It was, in fact, the right proposition to bring. And so, sir, I will also be supporting it. Thank you.
Thank you very much. Senator Deputy Morell.
Thank you, sir. And yeah, I've had to quickly adjust what I was going to say, sir. I'll start where I was intending to start in the first place. All patients in hospital, sir, are by definition vulnerable, and they are vulnerable to infection. And COVID is, without doubt, an infectious disease. And whilst it may be the case that there are high levels of vacancy amongst the staff, and this is part of the cause, perhaps, of the closure of the hospital to visitors, I feel it's important not to conflate that issue with the issue of preventing infection and disease. And those two matters have to be dealt with separately, and I believe it is right, the Constable of St John and others, to raise the issue of staff vacancies and why they are there. Those outside of COVID, caused outside of COVID. And so I was going to say that as a member of the States, I think I am fairly well known over the last three years or so as being someone who questions pretty much everything. And I do question why we have got to the point of having to stop visits to the hospital. But to question why on that matter is not the same as questioning that we have to do it and stop visits. And so, sir, that's where I thought I was, because I thought, you know, if the health minister is not supporting the proposition and he's being led to that position by the doctors and nurses who run the hospital at the clinical level, I thought, well, because I am not a doctor or a nurse, I have no more medical knowledge than anyone else in this assembly. So when it comes to the issue of clinical operations specifically, I feel that I have to defer to the doctors and nurses, as they are the ones trained and who work in this area. We've all learned over the past 2 years that a public health crisis and civil liberties clash. And this proposition, sir, squarely addresses that conflict. And in that sense, at an intellectual level, I'm pleased that Deputy Tadyer brought up this proposition. And in fact, now that the health minister has indicated his support, I'm even more pleased that he brought it. However, my initial stance was that as a non-medically trained person, I feel that I have to defer on such operational matters to the doctors and nurses who make these difficult decisions. So, sir, I thought I was going to speak to say why I could not support the proposition, as much as I understood why it was lodged. But, sir, given the health minister's indication of his support, and I can only believe that that support is driven by advice given to him by the very nurses and doctors who I've been talking about, I feel that I am now in a position to support this, because I assume that his decision to support is led by medical advice. Just one thing that I wanted to mention is the health minister repeatedly yesterday and today mentioned that if there are people who are complaining about treatment or complaining about working conditions, that they should pass the details, us the states members should pass the details to the health minister. That's fine where the person has said, I want you to pass the details, or in response to a question by me or another states member says, yes, please pass on my details. But we cannot pass on details of people who have asked us not to. And we have seen, you know, one of the frustrations that many states members and many islanders have had is how we are not still getting all the information that we believe we would like to have about the nature of people who have COVID in hospital. Did they contract it in hospital? Did they not contract in the hospital? Were they there primarily because of COVID or for other reasons, etc.? These are the sorts of questions we've been told time and again, well, we can't say that because it might identify people. It's a data protection issue. And so actually handing over an islander's name to the health minister is a massive data protection issue. And so I would ask, whilst I appreciate the health minister's deep frustration that he feels he can't act on such complaints, that is unfortunately where we are. The health minister himself uses that reason for why he can't provide other statistics. And so that is the reason why we can't always pass on the information of who is complaining. And so, sir, yes, I'm quite surprised that I'm now in a position to be able to support the proposition. And I thank the health minister for his intervention. Thank you, sir.
Thank you very much, Deputy Morell. Deputy Pamplin.
Thank you, sir. And I'll just start by offering my apologies for missing some of the debate as I messaged in the chat for the benefit of those who didn't realise I had some. I received a call to hear that sadly my grandmother had passed away on the day we were mourning my other grandmother, who'd also passed away 5 years to the day as well. So apologies for not being fully engaged in the debate, but I wanted to ensure that I spoke as it's important to do so. And I just wanted to say, having gone through this experience personally, about the decisions being made to visit vulnerable people in care, you go through a range of emotions of your duty. Doesn't even matter what position you hold in civic life, how you're seen to be doing the right thing, but equally a humane point of view, and then what of course is right in for your own personal beliefs. It's difficult, and everybody has been through this in one way or another. That is the great unifier of this pandemic, is we have all, every single human being has gone through this for the last 2 years, and it has all bared all sorts of experiences, frustrations, life-changing events. As Deputy Rowell just mentioned, the tensions between rights and doing the right thing. As I've always said, as I've tried to do in my role, is to, as other speakers have done, is to speak emotionally, but with my head in place, and to look at the facts and bring them to when they required. Sometimes you do not need to, you let others speak, which is why I didn't take part in yesterday's debate. I thought others spoke bravely and firmly, and I was not needed. But I just wanted to add, in this context, that, and also something I've said many times over the last couple of years, is communication is critical in this whole thing we've gone through. It is, in a crisis, as I've said before, it exposes everything. It exposes all the good things, and it exposes things that are not so good, and we are living and breathing that, and it's something we've all had to wrestle with. However, communication is just one of those things that still sticks out for me as something we're just not getting right. Why can't we compassionately step back before announcing a piece of news and making sure that everybody who should know first knows first, that we sound out people who can maybe enhance it to make sure we've got every word right, that it comes across as empathetic and caring, strong if it needs to, understanding if it obviously has to, because when those things don't happen, there is so much cynicism and so much frustration out there right now. The gaps in those knowledge, it falls through and we end up divisive. And if anything, we've got to get to a better place where we don't have that decision making. If only the communication around this could have been thought through. I mean, I only heard about the temporary visit because somebody had phoned up because they'd seen it on Facebook. And then I saw we had been sent a press release email. That was how the news was given to us. And I just feel that, I know it's tough and we're all working long hours and long decisions, but just think before you release a statement how people are going to react. Talk to your state's members. We could have helped, and I know that's hindsight, but I think it's important, if we are going to learn anything from this pandemic, we need to look around the world who are doing the same things, making difficult decisions, and then contextualizing them for us, what we need in our local health system with its one hospital, its depleted staff. We're looking for its community to support them once again. It's inexcusable to unload and put your frustrations onto anybody in authority, be that a nurse, be it a porter, be it a policeman, be it a prison officer, be it anybody. But please make sure you are reaching out and offloading, but do not take it out in the worst possible time. You will regret it. It is unfortunate that's happened in our hospital. We can do better. I'm glad Deputy Tadya has brought this, but I just urge once again, anybody working inside the delivery of anything left to do with this pandemic, please use us in the Assembly who can help you with the communication, that we take a step back and we avoid debates like this. Thank you, sir.
Very much. Deputy Young.
Thank you, sir. When this came to the Council of Ministers, reluctantly, I was prepared to agree with it, because I think it's desperately important that our hospital is a safe place. It's a place where we're all of us are at our most vulnerable. But I did say that I wanted to have exceptions. I wanted the clinical staff to be able to decide on an exception basis and obviously end the life of one of those, and there are others, and of course maternity services were going to be accepted anyway. But I did say I thought it should be a temporary period until we have a system, because I do think it is possible. It will be expensive. It will require some organisation. I don't think it can be done on wards with people taking tests and sitting around for 10 minutes waiting for the result. Like Deputy Martin, one could have, I want to avoid designing a system, but I do think it is possible that system could take place elsewhere than the hospital, but nonetheless, I think it is possible. And of course, what we all need is that during the debate, when this debate started, I absolutely was very much with the proposition because of all the reasons that members have spoke about in a very moving part of the debate. But of course, things have changed very much now with the minister's surprise. Really, I think obviously when looks at the proposition, I think he's right that the words that we've asked to approve are probably, I think they're, unarguable, that we don't want people in our hospital who are going to give infections to people in the hospital, and we want and the key words for me is a robust system. A robust system means what it says. And so that's what I rely upon now in the choice that we've got to make. Until the minister made his decision, my principal motivation was to act for the staff, because I am really worried now about the kind of aspect that's popped into this debate in the last few speeches, which I think are conflating the issues yesterday that we discussed, which is really about who runs the health service, and with this issue, which is very much, in my mind, is definitely a clinical operational role. That conflation, I think, is not helpful. I really do not want our hospital team to feel somehow that we as politicians are not supporting them or undermining them and not valuing their judgment. I'm really worried about that. So I plea that all of the with the ministers and all of us as members to really do everything we can to communicate our support for our valuable, wonderful health service workers who are not well paid, in my view, have gone through unbelievable privations in the recent years. And of course, I absolutely agree, though. I do agree that we've got to stop this business about trying to spin situations and avoid facing the realities. Things are not all well. But we are in this together. We have to find solutions. But that is an issue for another day. And we must, so I think where we come to is that therefore I do have to support the proposition. I'm surprised at that. Because the test for me is, could our politicians, our clinical people going to feel undermined and undervalued and being presented with a task that they can't possibly control infection risks anymore? Well, I think that's why the key words to me, a robust system, whatever that is, and that's going to cost money. And so I say to the minister and the officers, put your request in straight away for the money. Let's have the mechanics in place to put this into reality as soon as we can. Thank you, sir. That's all I wanted to say. Thank you.
Thank you very much. Deputies, any other member wish to speak on the proposition? No other member wish to?
Yes, sir.
Chief Minister.
Yes, thank you, sir. I'm actually quite pleased, just briefly to follow the previous minister. Sir, I think I'm going to turn my speech around in a slightly different order, because I do agree, well, I agree almost all of his remarks, but I do actually want to address the comment he made around staff, sir. And firstly, to reiterate the comments of other members and obviously the health minister and the comments I made yesterday about absolutely commending our health staff, and particularly in dealing with the difficult scenarios we've been dealing with over the last 2 years. But sir, one of the stresses, the added stresses that gets added to their workload are debates like this, and debates that we had yesterday, for example. And I have to make the point that there were some comments yesterday that were completely inappropriate at a staff employer relationship level, but we'll come back to that on another day. And so I think the support for staff needs to be practical as well as just verbal. But to bring us back to the actual subject, sir, if it was a simple answer, we would have done it already. So we are comfortable, sir, supporting the proposition, because It is not unreasonable that this matter is brought to the Assembly. It is obviously a very important matter, no question. We all recognise that. As I said, if there'd been a simple answer, we would have sorted out earlier this week. Minister's been very clear from the first point this was raised with us that they would, for a short-term period, we could support it, but for the longer-term period, we felt there needed to be remedial measures put in place because of the issue around visitors, and which many members have already alluded to. So what we've got to be clear about is that in itself, the proposition isn't going to change anything overnight, today, whatever. Either we will come to a scheme and we will find it, we will find that solution and we will get it in place within the time frame that we're dealing with, because obviously we all hope that the numbers continue to fall, or we won't be able to come up with a robust scheme and matters will continue as they are. Because ultimately, and this is actually where that's what the proper wording of the proposition allows, which is right. And actually, it goes back to that point that Deputy Morrell made, which is we mustn't be challenging at a clinical level the professional judgment responsibilities of those who are responsible for keeping patients and staff, but patients particularly, vulnerable patients, safe. And that's where it gets tricky in these areas, but whether it's not for us as politicians to make that sort of decision, because the responsibility in a very practical way sits with the professionals. And we need to defer to their knowledge and experience of the health professionals. But broadly speaking, that is what we've been doing all the way through the pandemic. But anyway, sir, I don't think I need to say too much else other than we've got to avoid trying to design a system on the hoof. I'm sure we will all be guilty of that privately. There are suggestions that have been made, and to date, we've not yet found the solution. One is dealing with potentially up to 500 people a day. That is different. Certainly, I think no less than 150, 200, depends who one has to test. And therefore, that does place different logistical issues in the context of testing people coming into the hospital. So go back right to the point, the wording of the proposition is such that if we can find a solution, we will move forward, there's no question. If we cannot find a robust solution, then we will have to see what other remediation measures we can put in place. But what we've got to do absolutely is recognise that ultimately, even if it is uncomfortable, it is the clinical responsibility of the health staff to make those judgments as to where the ultimate balance of risk lies in their operational responsibilities for keeping people safe in the hospital. As I said, if it was simple, we'd have done it already, and we very much want to do it. So from that perspective, that's why we are able to support the proposition, having again carefully looked at wording and taken advice, particularly from the PREF. And on that basis, again, we are supportive of the wording of the proposition as it is written, but actually, sir, we have been trying to sort it out in the previous days anyway. Thank you, sir. That clarifies the position.
Thank you very much, Chief Minister. Does any other member wish to speak on the proposition? No other member wishes to speak? Then I close the debate and call on Deputy Tadier to respond.
Thank you, sir, and thanks to the members who spoke. It seems that we vehemently agree with each other, indeed, as we did yesterday. That didn't stop us having a robust and maybe fruitful debate nonetheless. Sir, I do want to address this dichotomy quite early on, that these are just simply operational and clinical decisions to be made that we must follow automatically. Because if that were the case, why did it come to Council of Ministers in the first place? We were told that there was a discussion which presumably took place maybe a day or so before or on the same day as the ban was imposed. And it sounds like it was discussed, but if there was actually no meaningful, I'm just going to plug my laptop in, sir, because I've got the battery running low. Apologies. So if it were the case that ministers had a genuine choice, either politically or actually, then why were they, if they didn't have that choice, why were they debating it? Was it just simply to rubber stamp? And the point is, of course, the management of the hospital does fall to the managers, and the safety of it is down to clinicians, but there are wider considerations, as I said at the beginning, because this isn't simply about clinical decisions. This is about the wider political context. And when you start to tell patients what they can and can't do, and visitors what they can and can't do, that's when it becomes political. So that there are balanced judgments to be had here all the time. And I suppose just to put that in context, is that something that we've heard from Dr. Muscat himself throughout the entirety of the pandemic is that there are harms and there are counter harms, and there are risks and there are counter risks, and it's about getting that balance. So it's not inappropriate that at the moment we question what the counter risks and the counter harms are in the current visiting policy. So that's absolutely right for politicians to do that. That said, I do accept that it's not ideal to be discussing these things as a first resort, and that's why I did everything within my power as soon as I heard about this to contact, obviously, states members, to contact the minister. Had several conversations with the minister, for which I thank him, to see if we could find a solution and to see where this was going and what the timescale was. But unfortunately, we couldn't really come to an agreement, and I couldn't get the reassurance I wanted to know that safe visiting could be put in place at any time soon, hence the proposition. The Constable of St John's, I hope that on balance now he's had the answers that he wanted to be able to support this proposition. I know that Deputy Pershard has had strong thoughts about this for quite a while. She said that she would be angry if she had been told that she could not visit her relative if what happened back then in the pandemic was happening now, with all the changes that have and all the improvements we've seen to testing and to safety. And Deputy Doublé similarly has said that it is right that we do take human rights considerations into account. She said she's still concerned that we have all of these restrictions in place now, 2 years on, and I think that many people would agree with her on that in the wider public. So I'm glad that the Deputy of Grouville spoke up and spoke out about her opposition that she voiced during the B agenda, presumably the Council of Ministers meeting, where she said that the imposition of the visiting ban was draconian. And she put it much better than I did when she said that it doesn't consider the holistic care of the patient. And I think that's right. Again, it's right that the staff and the clinical staff want to keep the hospital COVID free, but similarly, it's our duty to consider the holistic care of the patient, and not just the patient in hospital, but the visitors and the wider societal impact. Deputy Wickenden, I think we're arguing on the same side ultimately, and this isn't a case of ignoring the staff and what they're telling us and ignore it. On the contrary, what we're saying is that we want to make sure that the hospital is sufficiently staffed and resourced, and that COVID doesn't get onto the ward in the first place. Remember, COVID did get onto the wards exactly because we didn't have a robust system in place. And slightly shifting the order around in which people spoke, I have to say that I was moved by the Constable of St Clement's speech. He spoke from a very personal point of view. And I would say to him that actually what we're asking to do here is to put that robust system of testing in place that was never in place before, notwithstanding people's best intentions, so that actually staff, patients can be kept safe, so that people in that critical situation that he found himself in can also have the knowledge that they will be kept safe. Just to Deputy Wickenden, it was unfortunate that he wouldn't let me have that point of clarification, because what I wanted to ask him, and it would have given him a chance to respond, I get to sum up, but he doesn't get to respond to my question now. He said he agrees with me that people on the ward should not be the ones doing the tests, or in fact, they shouldn't be the ones that are having to triage who can come in and who can't come in. And that's exactly the point. At the moment, they are having to make those judgment calls. And so we need a robust system in place to do that. Deputy Lash said that we've got an excellent civil servant in place, civil service in place. I fully agree with that, that acting to the best of their ability. And because we've got such good civil servants in place, designing a system that is robust and secures all the rights of visiting that are reasonable and proportionate, whilst keeping COVID out of the hospital, shouldn't be beyond the wit of our excellent civil service. Deputy of St Martin's again said that it requires the wisdom of Solomon to try and police these current exemptions, who's allowed in, who's allowed out. There's a lot of subjectivity in that, and that's what we have to take out of the equation. We need clear rules, maybe, you know, named visitors who we know that are safe, that can come into the wards, so that we don't have lots of people milling around unchecked. Absolutely agree with the Deputy of St Martin in that respect. But again, I add what we have had up until now, that's what's increased risk to patients, not this new system which we should be putting in place. Deputy Ward, again, he talked about acting reasonably. And what I took out of that is that, yes, again, we need a robust system in place. When will this end, the current ban on visiting? And I would ask, what is to stop this happening again? So if we simply say, let's do nothing and let's wait until COVID is no longer in the hospital before we allow people to visit again, what assurances do we have that this won't simply happen again? And people, for the most part, have been acting reasonably, and I think they want us to act reasonably in return. I thank Deputy Martin for what I thought was a very measured speech. Now, she commented on Deputy Doublet's comments about monetary, and if this had been about a monetary decision, it would have been much more flexible. I'm not sure I would have gone down that route personally in my arguments, but what I understood Deputy Doublet to be saying is that when it comes to family members, they often don't have the platform or the voice for speaking up about their concerns compared to maybe other sections of the community when it comes to when we put restrictions in shops, etc. for travel. They don't have those community bodies that might amplify their voice. But this is still an important issue for them. And of course, most people I speak to are respectful of the hospital staff, and they don't want to rock the boat. That's a word I've heard, because they know they need to keep on good terms, and they're very grateful for the care that their family members are getting. But sometimes, of course, you do get people who are perhaps more vocal and forcefully putting their position forward about wanting to see their relatives. I think that's completely different, of course, from the unacceptable abuse that we see for people not wishing to comply. And that's exactly, again, why we need this robust system in place. I thank ultimately the Minister for speaking and supporting this proposition. What I hope is that this isn't simply adopted by the Council of Ministers and then they'll say, but we're not going to do anything about it because we're going to let this happen organically and we're going to reintroduce visiting anyway. There needs to be a proper system in place. What I would say, just to give the Minister clarity about this person who contacted me this morning, and I'm quite happy to go through this because I received a text message this morning at 7 minutes past 7, which I read out earlier, saying we're waiting to see my mum in hospital. She's receiving palliative care and we're told we're not allowed to visit. Another member of her family had contacted me last night about the issue. So I responded this morning at 7:25. Remember, this is the first time the person's contacted me. And I said, I just responded to her. She came back to me at 7:30. Remember, this is all before I've been out to walk the dog this morning. And I'm getting ready, preparing for the debate. And so I get back to her She says at 7:32 she's 92 years old, and it's disgraceful she can't have visits from her family. These are real lives being affected by the rules. Thank you for your time. Are we allowed to see her? Is it something that I can insist on? So I get back. Again, this conversation is going on. So I say at 8:52, when I come back, getting ready after my dog's walk, I said I've alerted the health minister, and this is after I've spoken to the health minister. I've alerted the health minister, can I give him your parents' name and details so he can look into the visit for you, if you are comfortable with that? And at 9:17 I get an update, which I didn't see immediately, saying we are on the ward now, pleading to see her for 5 minutes. They say we have to ring for permission first. We are waiting outside for them to get back to us. And at 9:23, the nurse is trying to locate a hood so that we can go in and see mum. So that isn't a case of me or saying that there's a problem with the system and not providing any information to the minister. That's me getting a message and raising it directly with the minister, going back to the constituent, asking for permission. And of course, this is happening a few minutes before a debate. What does that mean in real terms? I don't mind doing all that, and I'm sure the minister doesn't mind getting contacted me a few minutes before a debate of this nature. But we shouldn't be in the position where, first of all, somebody turns up to a ward to ask if the exemptions apply to them. The ward staff shouldn't be put in that position to have to deal with somebody coming up to the ward and then applying those kind of discretionary tests, making phone calls, emailing, texting states members who then have to ask the minister to get involved. The minister says, I want the details of that person so I can help, but then at the same time says, but even if I did get involved, I wouldn't really be able to change the decision anyway, because it's a clinical decision. That's not an optimal system to have in place. What I'm suggesting is that we have a better system than that, which where people know whether they can go and visit their loved ones, where they ticked all the boxes before, that they're safe, they don't pose a risk, and that there is that robust system in place. So I'm going to jump a few speakers. I thank Deputies Moore and Morell for speaking and for their support ultimately. And I do pass my sincere condolences on to Deputy Pamplin, who I think it speaks to his dedication and to his work ethic that he has come into the Assembly today when he could have easily been excused for, and many others wouldn't have been in a fit state necessarily to come in, but he wanted to join in this debate and knows that this is about a wider issue, and that ultimately it is also about good communication, because I think when a decision like this is made, it isn't simply something that can be considered clinical and operational, because it does have so many repercussions on other people, and also something that we then have to deal with. And I thank Deputy Young, who, despite saying that it was an excellent proposition, which was completely uncontroversial and needed to be supported, said that he was surprised that he was going to support the proposition. So it shouldn't be a surprise if it's a good proposition. It should be something that he would support. And similarly to the Chief Minister, sir, I would echo those comments that it's the staff are doing really important work right across this piece. And without any further ado, sir, I ask for the appel.
Thank you very much, Deputy. I ask the Greffier to place a voting link into the chat. I open the voting and ask members to vote. If members have had the opportunity of casting their votes, then I ask the greffier to close the voting. The proposition has been adopted, 38 votes pour, 3 votes contre, 1 abstention in the link, and a further 2 votes noted pour in the chat. Very well, that concludes public business for this meeting, and I invite the chair.
Could we have the 3 and the 1, please?
Yes, 3 and the 1.
Those voting contre, the Connétable of St Clement, Deputy Wickenden, and the Connétable of St Peter, and Deputy Guida abstained.
Very well. That does conclude business for the meeting, and I invite the chair of PPC to propose the arrangements of public business for future meetings.
Sir,
yes,
I did put a note in the chat and ask if I may correct one of my answers earlier this week, so I gave you.
Oh, you did indeed, and I did say I would allow that if it were possible. If you could explain, you think that you gave a wrong information in an answer to a question.
Yes, sir.
During question time, and you'd like to correct that information.
Yes, if I may, sir.
Yes,
I'll try and be brief. In my replies to Deputy Higgins' question about the Norfolk police investigation into historic planning cases, I believe I may have unintentionally misadvised the Assembly. This was because I misunderstood his final supplementary question about my own role in the matter. To put things right, I don't know all about the complaints, but I've had no direct involvement in the cases, but as an elected member in 2014, I became aware of one of the complainants, and I did actually try to help that person. Since then, obviously, I've had no further involvement until hearing from the Norfolk Police at their briefing on the 16th of December 2021, sir. So I apologise for that. It was unintentional. I made a mistake. I misinterpreted the Deputy's question. I've apologised for it, sir. Please, thank you.
Thank you very much, Deputy. Very well. Now, that concludes public business for this meeting, and I invite the Chair of PPC to propose the arrangements for future meetings. Deputy Alves.
Thank you, sir. 4 additional propositions have been lodged since the publication of the Consolidated Order paper, and these are listed for the meeting on the 1st of March. They are the draft children arrangements to assist children to live outside Jersey Amendment, Jersey Law 202 P9 2022, the draft ecclesiastical legislation consequential amendments, Jersey Law 202 P10 of 2022, trademarks, registered designs and patents application forms, Jersey Regulations 202 P11 2022, and the Order in Council adoption of new canons P12 of 2022. There are currently 19 propositions listed for debate at the next meeting in February, including the Common Population Policy, the Draft Children and Young People Law, and other propositions that might be expected to take some time. So members should expect the meeting to go on until Thursday, if not longer. I'd like to take this opportunity, therefore, to remind members that Friday is identified as a continuation day and should therefore be in members' diaries as a day that could be used for business if needs be. With that, sir, I propose the arrangement of public business for future meetings.
Thank you very much. Does any member wish to speak on those arrangements or have any further things to add? Very well. Then I will take that as the Assembly accepting the arrangement of public business as proposed by Deputy Alves. Accordingly, that concludes matters, and we stand adjourned until the morning of the 8th of February.